Devin. And just a reminder, we are going to record the meeting and we're live streaming. So by being present, you're giving your consent for the recording, and I'll start that now. Just give me a minute. All right, it's ready.
Okay, good. Still afternoon. Okay, good afternoon and welcome to everyone. We'd like to call to order Macon County Health Department Board of Health meeting for December 21st, 2021. Roll call, please.
Vivian Goodman,
Present.
Mark Scranton,
Here.
Jan Hack, Sue Krause,
Present.
Candy Clevenger,
Present.
Jeff Entler,
Here.
Debbie Hill,
Here.
Dr. Brett Jerger,
Here.
Dr. Bailey Conti, Cody Parks,
Here.
Dr. Janet Patterson.
Thank you. Approval of agenda topics. Are there any additions to the agenda or any changes?
Make a motion to approve. Second.
Okay, a motion and second. Roll call vote, please.
Vivian Goodman,
Approved.
Mark Scranton,
Approved.
Sue Krause,
Approved.
Candy Clevenger,
Approved.
Jeff Entler,
Approved.
Debbie Hill,
Approved.
Dr. Brett Jerger,
Yes.
Cody Parks.
Approved.
Motion carried. Thank you. Before we get into public comment, I just want to remind the board that there is an issue of, well, when there is an issue of conflict of interest, it is in our bylaws, and I think we've kind of maybe overlooked this in the past, once or twice, but if a board member has any personal or business interest in a board topic, it is a conflict of interest for that board member to be involved in the actual discussion and the voting. So what was confirmed with Mike Baggett today was that they can discuss or bring it up in public comment if they have anything that they want to bring. But as a board member, when we get to a topic of discussion where there is personal or business interest, or even if you have relationship with someone involved and it's a conflict of interest, the board member is not to be involved in the discussion or the votes. Are there any questions?
So is this relative to anything in particular?
No,
Why this was brought up, or relative to the situation with Cody and the health department?
So I am not really up on what all
Okay.
happened last,
I just wanted
when I wasn't here.
to open the discussion.
So
I know it's the
I'm
state,
sure.
but somebody's gonna be accountable for this at some point.
Well, I believe that's the Attorney General's office, and I don't know. Basically, on their website, it says that the website is down. I mean, it's been like that, as you know, for a long time, so I don't know.
I would defer, ask a question to the state's attorney. Do we have any potential liability, having not gone through that process for new board members that have not had OMA training?
Well, let me ask you a couple of questions so I can understand the situation. The training itself, is it supposed to be provided by the Attorney General?
There's the required training that people are supposed to do within that 90 days, so.
And is there a requirement that the Attorney General be the provider of that training?
I don't know, I can't speak for that. That's what
That's a good
has
question.
always been, yeah, our
That's where we're gonna
understanding.
go for the
I
training.
mean,
That's my
clearly,
understanding.
clearly if the Attorney General is the sole responsibility for providing that training, then if they're not providing for the training, if there was something happen where there's a lawsuit, a lawyer's gonna sue everybody they can, okay? But ultimately liability in that situation, in my view, would rest with the Attorney General's office. But, I'll make a note, and I'll have to look into that and see, and this is, you're calling it OAM training?
OMA training, Open Meetings Act.
Oh, okay.
They have the training for FOIA on there as well, Scott, just so you know.
Right, not sure, okay, now I know, I didn't recognize the acronym, so now I know what you're talking about.
Well, I'm sure you probably had other organizations that are dealing with the same issue, because it's not just exclusive to this body.
Yeah, I think the problem there, and now that I know what you're talking about for sure, I think the problem there is that it's not going to be the Attorney General's sole requirement to provide that training. With the Open Meetings Act, they're going to expect the boards to be aware of that and to follow it. So my guess is that we do have some exposure there because it's not going to be seen as the Attorney General's responsibility. The responsibility is going to be for any public body to conform to the Open Meeting Act. So let me see, I'll talk to Mike and see if maybe we can get around that by perhaps doing some sort of in-house training by our office, but I don't know, let me look at it. I might get back to you on that, Randy.
Thank you. And if you could ask them about FOIA as well, Scott, we just as a best practice have had our leadership team and administration train on that each year too, just so they're as aware as possible of those things. So we would have staff that would be interested in receiving that training also.
All right.
Thank you. And then, to your point, Mark, about getting everything, aligned the same way, is the board okay with me switching the authority document to June, since that's when we have all of our new people in effect? Is that okay with everyone? Yeah?
Sure.
COVID-19 updates.
Okay, there'll be a lot more to discuss later on in the agenda, so if anybody has questions, I'm happy to answer those.
Financial report, Sheree?
Okay, the report is as of November 30th, which is the end of our fiscal year. However, I have not been able to get all of our year-end adjustments in yet, so some of these numbers will change. Right now, our ending fund balance before the year-end adjustments is at 5.5 million. Total revenue was slightly over 8 million, which is 82.4 into budgeted revenue. And total expenditures at 7.6 million, which is 79.5% of budgeted expenditures.
Questions for Sheree? Not, I entertain the motion to approve.
Motion to approve the financials.
Thank you. The roll call vote, please.
Vivian Goodman,
Approved.
Mark Scranton,
Approved.
Sue Crowe, Kenny Clevenger, Jeff Entler,
Approved.
Debbie Hill, Dr. Brett Jerger,
Approved.
Cody Parks.
Motion carried, thank you. Okay, and review and approval of department expenditures. They are in the report. Anyone have any questions? If not, I will entertain a motion to approve.
Second. Make a motion.
Motion, okay. thank you.
Second, I'll second it.
Thank you.
Cody seconded.
Cody second, adjustable.
Okay, roll call vote.
Vivian Goodman,
Approved.
Mark Scranton,
Approved.
Sue Crowe, Kenny Clevenger, Jeff Entler,
Approved.
Debbie Hill, Dr. Brett Jerger,
Approved.
Cody Parks,
Approved.
Dr. Janet Patterson.
Okay, thank you. Motion carried.
Receipts in the back of those two documents. What do you want to say? First one.
Are there any grant applications?
There, no. Sorry.
You have the department division reports in your packet. Are there any questions for staff?
I just wanted to say, I think most of you know that we've been trying to keep a limited number of people in the room. Pre-COVID, we would have all of our director staff here at these meetings so that they could answer questions. They've been joining virtually, but we do have a few of them in the building and readily available tonight, not just to answer on here, but then to come in and kind of touch on the parts of the meeting that are a little bit more detail about their department. In the room right now, of course, y'all know Lakia and Sharice presented, and then Bethany's our assistant administrator. So they'll be in here tonight, and then we do have a couple of other people that are going to be available if have questions during those sections. Also wanted to just say, specifically, we've had some reviews here recently. We had a WIC and family case management review, and then we had an admin and human resources review, and those went very, very well. The one with DHS for admin and HR. I was on with the Cherie during the exit interview, and they were going on and on about the health department being a role model and being the top reviewed agency out of all of the ones that he had done in the entire state, and that you could tell all of our stuff was together. And so I just thought you all should hear that. I thought that was pretty amazing. And then another number that we came upon here recently, you probably saw in your report, in addition to all these other things that we've done, we did hit the milestone of 15,000 COVID vaccinations in addition to everything else that is going on here. And that obviously has been a building-wide effort. Plus, we've had volunteers, Medical Reserve Corps, and also nursing students that have come in and helped us with that endeavor. So that was a really big deal. And then yesterday on the IDPH call, I heard something that hit home a lot because we're always talking about saving lives through contact tracing, and they were able to put some estimates on that for the entire state of preventing approximately 200,000 cases and approximately 3,500 deaths just for contact tracing. That wasn't for vaccination or anything else. But I thought that was pretty cool to get a number and be able to actually quantify the work that's being done and share that with the team. So just wanted to kind of highlight those things. Of course, there's a lot of other things going on here, but I did just want to point those out since they had come to my attention recently. That's all I have.
Thank you. And I did receive a letter from IDHS regarding the fiscal administrative review, so great job, guys. Thank you. All right, employee recognition, December anniversaries, we have Marissa Holzer, 7 years, Pamela Day, 3 years, Nicole Dial, 1 year, and Abby Sigler, 1 year. I don't want to mispronounce her name. So we want to thank the staff for their service and wish them a happy anniversary.
Can I interject one more time? I wanted to also let you all know that if you know Becky Edwards, she's been our director of Starting Point for some time, and she's been with us for 21 years. She is moving on to a new chapter in life, so this is her last board meeting that she's joining us on, and I don't really think we can put into words the impact that she's made in our Starting Point division, which is Aging and Disability Resource Center. So extremely grateful, and we'll miss her very much. And then the person that's replacing her is Teresa Smith, and she has been with us for 20 years and is the assistant director in that division. So very happy that we had someone that wanted to promote from within. So thank you so much, Becky, for your service here.
Thank you, Becky, and we wish you all the best. All right, old business, mobile food truck ordinance.
So I just wanted to basically inform you all that did pass at the county board meeting. I don't know if anybody has any questions about it, but I just wanted to make sure everybody knew basically what the follow-up was with that. And how, you know off the top of your head, perhaps how many? I know you gave me an update a couple weeks ago.
So we had 4 or 5 apply for all of December with temporaries. And there's 2 more that are getting ready to apply for at least 2 weeks in the beginning of January, simply because it was delayed at the county board, so we were delayed getting it out. But we have received lots of phone calls that a lot of our seasonals want to go year round, so they're just waiting to get the paperwork.
Thank you.
You're welcome.
All right. And update on contact tracing and mass vaccination limits.
Okay, so this is kind of a general topic, and then Mark did reach out to me to add the next 2 bullet points. So I'll just kind of go over the general update of what's happened since last month, and then Mark, if you wanted to touch on the specific discussion topics that you wanted to talk about. So with the contact tracing grant, you all have the update as far as the funding and everything. But the other change that has occurred, and this was literally late last week, is that the state is moving to a centralization of contact tracing. So if you recall, I talked about the Surge Center and that they're handling most of the cases right now. A lot of what's taking our time is the more vulnerable population. So our seniors, our children, schools, and then contacts of kids in schools. So the centralization is basically going to be that all cases initially go to the surge center, and then they are basically put through an algorithm of if the surge center will handle them or if they will be moved to the local health department. The state is saying they don't expect that this will cause, many changes for the schools. The expectation and the hope is to lighten the load for health departments. And then obviously our funding is expected to end for this specifically March 31st. So it's going to help basically with the transition of that. And we will still be here for example, cases that someone maybe doesn't have a cell phone because there's a whole text messaging program that they're going to use for positives that people have the choice to opt in or out to the contact tracing process. So this is very, very brand new to us, and we've been on a lot of phone calls in a few days with the state and with other administrators working through it and trying to figure out exactly how the logistics are going to work. And then of course, talking with our team about logistics. So we are getting them an update and some messaging out. We've requested as administrators across the state for the state to give messaging so that it's all consistent and so that the public knows that this change is going to happen. But we are preparing our own just because sometimes there's been delays with communication coming from the state. We also are going to send something out to superintendents because some of them are already getting wind that there's going to be changes at the state. And I think some of them are getting concerned that there's going to be more work for them. So we are just going to send them a little something that just lets them know we're still going to be here, to support you after the first of the year. And we're still learning about logistics, but that we will be here and we will work through it because, like I said, we just found out about this last week and the go live date is December 28th. Many administrators across the state have gone together to request that the state push that back, but I don't think that they will because obviously schools are on break and there's holidays involved in here and everybody's very busy with a lot of things with year end. So I don't know that that date is going to move, but we do want to at least reach out to the key partners and let them know there's going to be a change. We're going to work with them on it because I know that there's probably going to be some concerned schools about what that's going to look like. So I don't know everything yet because we don't have everything from the state yet, but I do know that there's going to be changes and that we'll have some logistical stuff to figure out as we transition with that. And then.
So again, the contact tracing as a whole will change.
It will,
And
yes.
the first level of contact is that state phone number.
It will. So they're going to send out an automated text message. And then if someone doesn't have text messaging, which obviously a lot of people don't, and a lot of the senior population doesn't, they'll automatically get sent to us at the local health departments and we will work those cases. Anybody in congregate care settings, we will work those cases. If there's a cluster or an outbreak identified, that will be given to us. Part of the intention with this is that we have more time as health departments to focus on outbreaks and clusters, which that's something we normally do with contact tracing pre-COVID, with communicable disease. We monitor those cases, follow up on them, and then watch for outbreaks, try to prevent the spread of, whatever that illness is. So that will continue. It's just going to look very different than what it's been. So anything that doesn't get funneled to us, the surge center will have. For a while, because of the sheer numbers that we've had, a lot of our cases have been going to the surge center and they've been working them, which does cause some confusion across the state because if people are trying to get a letter, let's say for work, they have to call the surge center. If the surge center doesn't get back with them quickly enough, we don't have their case. And so it has to be sent to the state. So trying to work through that, I think, is going to be a little bit interesting because we also have a lot of, employers, for example, throughout the community that expect a letter. And if most of the cases are being worked at the state level, they have to give the letter. We won't have it. So we also have been talking about to employers in Macon County just to let them know that we won't be able to readily provide those anymore. They will be working with that centralized surge center. Answer your question.
So to follow up on what Jeff just said, because I'm a little bit gray, which kind of goes into my question I had for the agenda. So does that mean that we're transitioning into a different level where we're not going to be doing active contact tracing here at the health department? It's getting kicked upstairs, so to speak, to do that?
We will still be doing contact tracing, just most of the cases the surge center will do. What we will be doing is people that don't have, a cell phone, for example. So some of the older population, we will be doing people that live in congregate care or that work and congregate care. So jails, prisons, long-term care, assisted living. We will be assisting at some level, and we don't know for sure what that is yet, but schools to support them, because as you know, they have a lot to do as well. But most of those cases will be at Surge Center, but we will still be working some of them.
So,
What would you guess, what percentage is going to the state level and what percentage will stay here?
So right now, a bigger majority is going to the state just because there's so many numbers, and that Surge Center was created to support local health departments if there was a surge, or, you know, if you're short-staffed or something like that. So what we've been doing is, with all of the school contacts, we've been getting about, let's say, 20 school contact lists a day. So that means if there's 20 kids that were positive, here's all the kids that they were around at school, on the bus, in sports, whatever. And then that list comes to us. We have to call all of those people, children, teachers, et cetera, and tell them, you know, you're quarantined, and talk through it with them. So we've been doing all of that piece, and then sending as many of the cases as we have to Surge. So I don't know the exact percentage right now of what we're sending versus what we're not. The state's intention with this is that local health departments won't carry as much of a, and it'll be more centralized with that Surge Center, especially since that funding is set to run out March 31st. But they do still want us supporting the more at-risk cases, the congregate care cases, and then if there's clusters or outbreaks.
So in speculation, they would really expect to do a majority of the cases if they're not giving you any more contact tracing number. They would do 90+% and the smaller amount you would do just like it was a normal,
Yes.
not the right term, of one of the communicable diseases that you do contact tracing on that's non-COVID.
Yes, that would be the expectation. It may not be, you know, end up being as much like in the 90% area, because if that initial text message fails, so that's going to be anybody that doesn't have a cell phone that receives text messages. And we all know we do have a large percentage of, you know, seniors in our community, and I know some seniors text and all of that, but that's going to be where you're going to see people that don't have texting, and that text message will fail. Those will automatically get sent to us. So I think that might be where there's still going to be somewhat of a decently sized workload. And then also, if we're supporting the schools, you know, as we have been, that is a significant workload as well. That's one of the big questions that administrators have been asking the state, is about our role with schools, because we have really all helped schools a lot because they have had such a significant work burden with this. One of the concerns with these changes that a lot of us have as administrators is the schools are going to feel like more is getting dumped on them, and we don't want that to happen. So I think that's going to be one of the things that has to be worked through to figure out what can the schools do, or what are they required to do, versus how can we support them, at least to transition them. Because if we run out of funding March 31st and the other funding that's coming in January doesn't support that, or it isn't decided to budget for that, then they will have to do it on their own per the executive order. And that's the stance we'll support in the division for that. But I do expect that the people that we have on board right now, we are still going to need them, I think, through that March 31st date, because of the fact that this is a transition, and there is still going to be a significant number of cases that are being sent to us. So I expect that we will still need them. I know some health departments have said they're basically going to, you know, by attrition, like if people leave, they're not going to refill the positions. They will just have Surge Center cover more of it. And that, at this point, that's where I'm thinking, you know, we will probably go, you know, with the support of the board, of course, because if we need the people and we have the grant funding to cover them, or we lose it, basically, we do need them right now. And if the workload doesn't go down significantly, which I don't think initially it's going to, we do need them here. And so I would like to keep them. If people leave, I do not feel like it would probably be the most responsible choice to fill those positions at this time, or even after the first of the year, just because the goal from the state is to centralize that to the state. So the less we can do, the more we can continue to move to the Surge Center. The state did send out a survey yesterday that we had to complete by end of business that basically had us opt in or opt out of this process. If you opt in, basically you're gonna, you know, follow what the state's doing and utilize the Surge Center, et cetera. If you opted out, then you can't utilize the Surge Center. You got no more money, and you were expected to do everything on your own as a local health department, which is not really possible at any health departments right now. So I guess that's long
So you
answer.
opted in?
Yes, yeah. But I do feel like we should continue with who we have. We have sent and are gonna send some additional messaging to our staff so that if they get wind of this, or if the governor makes an announcement like, hey, we're changing contact tracing, that they're not hearing that in the next 2 days and wondering, do I still have a job tomorrow or the next day? And I did tell them at our last meeting, right now we're moving forward, business as usual. When I get an update, I will let you know, and that was before all of this happened. So I guess right now I don't have all the answers from the state, but we are working through it. We are communicating with our staff, with you. We are going to communicate with the school superintendents. We are going to ensure everyone through the building has a script. They actually already have it today, that if people are calling in to ask questions, that anybody that they would talk to here can basically let them know the state number that they would need to call, and that the state is taking the lead with contact tracing. I think there's going to be some upset people looking for letters that we as the health department can't provide. And so we're going to have to send them to the state. And we've already gotten a lot of complaints about the surge center and their lack of maybe thoroughly working cases and or getting back to people. So that may exacerbate that for a while for us. And that's happening in every other county that I've talked to the administrators, is they're catching heat for the surge center. So you'll probably hear that or see that, especially over the next month or so.
So how long has the surge center existed?
Ooh, that's a good question. Not very long. I can't remember what month it started, but not very long. They started it, and initially we had enough staff that we didn't have to use it, but we knew that if there was a surge, we could start using it. As we continue to have meetings every single week, and so a lot of the surge people are not doing things quite the same. So it has caused some problems for our health department. It's just not done exactly the same that we have done it, or they don't ask for the contacts. So then we have contacts calling us and they're upset because they haven't been called or they can't get their letter. So I do think that maybe will help once we get through the bumpy part of the transition. If surge is handling most of it, hopefully we won't catch as much heat for what they are and aren't doing, because that's not us. That's a separate entity from us. Okay.
I'd like to see for next month, as this goes forward, then I'd like to see a spreadsheet put together that would have, like, let's just take a snapshot of like the last 90 days, for example, of how many cases the contact tracers have actually been dealing with. And then we look at this every 30 days going forward, because you're telling me that they're going to take a majority of this burden off the health department, but then we're talking about keeping the same amount of staffing. And I can understand for a brief period of time as the transition goes, but I would expect by the time we come back next month, that you come back and say, hey, they're doing 3/4 of the work, we're going to cut our staffing by 50% or whatever. I don't want to see this, just because we have the money out there.
Oh, right.
I don't want to see this thing go to March and we're funded, we have the funding or whatever the case may be, that we're keeping 100% of people. If the state's over here doing, the Jeff said, 60 to 90% of the work, there needs to be some balance here as this thing goes forward. Either that or the system's broken, it's not working the way they planned, but the state's not known for the best laid plans sometimes. So nothing would surprise me, but I would like, just for informational purposes, I would like to see how this tracks out going forward.
We can definitely do that. So the Salesforce program that we use to contact trace, it has dashboards that can show how many cases each person is working. And I'll have to figure out a way to quantify this, but the staff that we have hired on for contact tracing doesn't just do contact tracing. So what we did is we have a full-time group of staff, and they obviously work every day. They have alternating schedules so that 7 days a week are covered. And then we have part-time people. So that is one of the ways that we have been able to limit unnecessary spending of having people paid just to sit around if there's not very many cases on a given day. We have our full-time people that work, and then the part-time, we schedule them, but then if there's a surge or if there's not that many cases, they basically are just called off. Kind of like if you're a server at a restaurant, like, okay, it's not busy tonight, so you go home. We have a whole process that they check in to see, do they have cases, do they have follow-ups, and then they would log off. If they're not working, they're not just sitting there. They also are staffing our mass vaccination clinics, and then we'll code that when they're working a clinic to the mass vaccination grant. And then they also are covering the COVID phone line. So we have a COVID vaccination line that people call to get their appointments and check their dates and in eye care and get their booster scheduled and whatever it might be. And then we also have the COVID hotline that's just the generic hotline of any COVID questions, or if you need your letter, or what day can I come back, stuff like that. And so we have worked to utilize them in different ways so they don't really have downtime where they're just sitting around, because I agree with you. We don't want to pay people to do nothing, even if there's money sitting there. So I can definitely bring the dashboards and kind of maybe just give you an idea of, how many clinics maybe, per week that are being staffed, or calls, because they're covering more than just contact tracing.
And Brandy, to Mark's comment, if we had to let people go, could the funding be used somewhere else?
So if they're, it depends on what the budget was compared to where we are at spending wise. Most of our spending and budget for that grant was for staff and fringe and stuff like that. There is some other things in the grant that have not been spent yet, like the electronic medical records that we're working on, for example. So some things we would have to ask for a budget adjustment and some we wouldn't, but there's a lot of things they already approved, and they're pretty quick about responding. If we have a question of something that comes up, like, can we pay for this because now we're gonna have extra money, we don't need these staff, of getting back with us and letting us know if that's allowed or not, so that we can hopefully use all of it in the most effective way possible.
Right. I know most of the work with the contact tracing is being now shifted to the search center, it looks like. With the variant coming in with the known high risk of transmissibility with this variant compared to the Delta, you have been needing more resources, right? More cases, more resources. Do you think the search center will be able to handle this all by itself without a local input?
Yeah, their timing's not the best, is it?
Yes.
It's the state, what do you expect?
Well, but
They
in
tell her,
fairness to them,
they got 2 days to get ready for this.
So I definitely agree. It's not good timing for anybody. And I agree with you. I know there's some discussion of whether the care resource part of this is still going to remain local or go to the state. We have had issues with the Surge Center being able to link people to resources that they've needed in our community. So if we can keep that local, I would really love to be able to do that. We also are partnering with Sister Girls in Action, that's the public health navigator group. So that is a local resource we can refer people to if they need something, and they do have some funding to help cover certain things. I don't know if the Surge Center can handle it. I hope that they can, because we've worked extremely hard to be able to handle it and be competent, make sure our staff are training very well with things as they change and update. And then also just being that local voice and answer. I do feel like part of that's being taken from us, which was kind of one of the concerns with this whole thing from a lot of administrators. But it almost was, there wasn't really much of a choice with it to do it. We did get a change yesterday that we were told we can pull cases. If there are certain cases we want, we can pull them. So what they originally told us, it was Thursday or Friday, was that if the cases are at Surge Center, we can't grab them in the system away from the Surge Center. What they said yesterday is we can. So if there are certain situations, we can pull it from the state to work it. I hope that they can handle it. I hope that they're ready for all the phone calls and everything else that they're gonna get for all the little kind of piddly things that our staff deal with every single day that are very, very big in some people's lives, like getting back to work on a certain day. If the Surge Center doesn't answer the phone, someone may be delayed of getting back to work, and it'll be out of our hands. We won't be able to do it once they're working the case. We won't be able to do anything with it. So I think that will be difficult for some people for sure. So I hope they can.
So you said the next 2 bullets are Mark's?
Yes.
Okay, so Mark,
So the first one, I think we pretty much just now covered that, but part of what I had sent to you, I had a question about specifically, and had somebody contacted me. So walk me through what the contact tracers do when they've reached out to somebody, because I had a citizen, I'd heard this, but then I had actually somebody call me, and they explained that the health department delivered groceries to their house. So where does that fall into place with COVID, and what's the criteria for that? Because the other side of the equation was, they said they kept calling back and asking for guidance on what to look for because they have a person in the house that's now been quarantined and nobody ever called them back. And this happened like a half a dozen times. They're like, what do I do? Does my child, do this? Do I do that? Do I go to the doctor? Do I go to the ER? And this person actually works for another governmental body that I happened to talk to, and they were like very, very frustrated. That's like, we got groceries that I don't need, but then I need help on how to watch for symptoms with my child and know what to do to take the proper steps, and I can't get the health department to call me back and tell me what I'm supposed to be doing. So there's two separate issues there, but the lack of follow-up and telling people what they're supposed to be doing is one thing, but the grocery thing caught me completely off guard. I had no idea that we're doing that as a health department. What's the point behind doing that?
Okay, so first question with the groceries, that is part of the COVID funding, alternate housing and food. And that's something that is it was in the grant application, budget approvals, everything. We've been doing that since we got the grant funding. So if someone is quarantined or isolated, and they for some reason can't get out or shouldn't get out to go get food, or if they're in a situation where they have nowhere safe to quarantine or isolate or to do so away from their family and their home, we do have that funding that's specifically used for those things. Housing, we have had some, the demand for that's dwindled significantly, so there's not very many of those. But the food is one that is more, because people are not supposed to go to the grocery store and get their groceries if they're quarantined or isolated. People do have to agree to take them, so we don't just send groceries to everybody or just randomly. They agree to get them, they give us, basically a shopping list. What we do then is our contact tracers refer that to our care resource specialist, which is a team that we have that handles those outside resources like your groceries, your food, if they need rental assistance, if they're not gonna be able to go to work and they're not gonna get paid, and sending referrals out to other agencies that help cover those things. We just cover the food and the housing part.
So who triggers that? Because these people had no idea the food was coming. They're financially well off. They were like, why are we getting this stuff? We don't understand.
The person would have to say that they need food and they can't get it themselves and agree to it going.
But does the contact
Agree to
tracer
the
initiate
item.
that process then, or how does it get started?
The contact tracer asks, are there any resources that you need assistance with? And that's when they would be referred to the care resource specialist that would work with them, say, what do you need? How can we help you? At that point, that person had to have agreed to wanting or needing food and tell the care resource specialist, here are some items I need. The care resource specialist then turns that into their supervisor, which is a team lead. They look at the grocery list, see if it's appropriate and under the allowable amount for the number of people in the house and the number of days that they're going to be getting food for, has to get it approved by that supervisor, and then they place the order for those groceries. So that person had to have known that was.
I've heard this, I'll be honest with you, I've heard from 2 or 3 different people. They're like, we didn't ask for this stuff, we just got it. So there may be a little bit of a glitch or some kind of communication gap somewhere along the way. Maybe it needs to be kind of looked at or something, because these people don't need to have the groceries. They're like, we have stuff in our house, we have money, we have options on how to get food. We don't know why we have this stuff. I'm just conveying what I've been.
I appreciate you telling me,
in front of me.
if you can tell me in private maybe who those were, so I can see which person was working that, to see if we have an underlying issue or someone that's doing something the wrong way or something. Just if you can tell me that in private, that way we don't discuss it openly, but I can definitely look into it, and if that's happening, that it can be corrected. As far as your second question, about calls back. So I'm not sure if they would have been being handled by the surge center. That's a possibility that call could have been missed. I mean, obviously people, are human, and not every employee is perfect
They called back here
anywhere.
to the health department,
Yeah.
and somebody's supposed to call them back and never got an answer for
Well, and
10
if they
days.
called 6 times, we do have a lot of systems of checks and balances put in place depending on where they call to ensure that those calls get made back. So again, if you want to in private give me that name, I would like to follow up on it just to see if there's someone that dropped the ball. But we do have people sometimes that complain we didn't call them, but they don't answer the phone when we call. They don't have a voicemail when we call. Sometimes our number comes up as spam because there's been so many outgoing calls, and that's something we can't get fixed. We've tried. So then people don't answer it because of that. Some people's cell phones block numbers that are unknown, so I'm not making excuses. We definitely also could have an employee who's just not doing what they're supposed to do. So
Well,
you
that
can
was my
let me know.
concern, that's why I want to
Yeah.
bring it up.
I appreciate that. Yeah, if you can let me know in private, and I'll definitely follow up on it. I don't leave that stuff because I'm telling you, all of us have worked too hard to make sure every phone call gets returned to just have people that just choose not to. So I will definitely follow up if you can get me that info separately.
And then the other issue I brought this up 2 or 3 months ago. Again, I'll reiterate my opinion. I don't know if it's something the board wants to take action on, but we're getting inundated every single day around the clock with everything in our world seems to revolve around COVID. And it's there, we have to deal with it the best way we can. But I brought this up 2 or 3 months ago that maybe the health department, should look at possibly doing weekly press releases instead of daily, because this is getting regurgitated so much through the news cycles. People are just turning this stuff off, and they're not even paying attention to it anymore. And I think, again, less is more. If you had a weekly update, because when you guys put out a press release, I'm getting 2 emails a day, every day from the health department. I'm getting it in all my news media feeds. It's being put, on the radio, TV, paper. It's being done over and over and over, 24 hours a day. And I think people are just like, it's like noise. People are just turning it off. And not only that, we're taking resources of the health department that we should be using for probably other things that we need to be dealing with, instead of doing these multiple daily reports on cases. I think it's a waste of energy. I don't think it's a good way to operate from a PR standpoint and provide the public timely information. That's just my opinion. I've heard from some other people that have voiced similar opinions about it, and I think just doing this on a daily basis after almost 2 years is just wearing out with people. And I would like to see us make some kind of direction or recommendation or something to staff that send a release out once a week. You're gonna get the same statistics. It's just snapshot once a week. This is what's happened over the last week, instead of doing this thing every single day.
Along that line, it'd be nice if we changed it, because it's the same thing that's going over and over again. And the other thing on there that I see, the total number of cases since the pandemic started, I think needs to be removed on that.
I agree.
I don't understand why that's on there.
It makes no,
The part of the information that's important to me is the number of people, because it helped me run my organization. I saw the cases were going up in Macon County, and knew it was going up there, what's happening here. So it let us do some things in our facility that help protect other people. The other thing that I find is important for me, being in the medical, is like when I know the hospitals are packed. There's a number of hospitalization. I agree, I don't care how many cases, I don't even look at that. Some of the demographic stuff, I don't look at anymore. I personally would love to know how many of the people in the hospital are vaccinated or not vaccinated, but I'm sure there's reason that's
Yeah,
not
we
being
talked about that before too.
put out there. So the number of hospitalizations and the number of daily cases does make a difference to me personally. When I'm organization.
Candy, I totally get where you're coming from as a medical professional with the type of operation you're in charge of, and I have no issue with that. I'm saying the public releases of information, people are they're burned out. They're tired of hearing about it. We've got other illnesses. I'm 60 years old, and I know that this has been a real challenge for everybody at different levels the last almost 2 years now. But we've never done daily releases on how many people are, getting sick or hospitalized from the flu, or name any other disease we're getting, whether it's diabetes or cardiac problems or anything else. We are spending so much of our energy. Again, this is why I brought it up last month about the STI clinic not being open for a year and a half. We're devoting so much time and energy to this. These other things are still happening in our world. People want to know, hey, is flu up? Are people in the hospital for flu? In the past, you can go back, I looked at articles that I did research on and found where the Herald Review talked about cases where they got specific statements of fact from both hospitals here in Macon County about this is what our flu level is right now. This is how many people have been hospitalized. This is what it was this time last year. We haven't seen that information in a long time, and we're not putting that out there every single day. We're not even doing it once a week. We need to redirect some of what we need to put out there that the public needs to be educated on, along with COVID, some of the other things that people need to be aware of. I mean, we used to talk about AIDS, and STDs, and HIV, and everything else. That was a common thing that you heard in the past for many, many years. As that problem got addressed, it kind of weaned itself down to where you don't hear about it as much anymore. But I think the health department has an obligation to the public to serve the public and address all the illnesses that are out there and keep people up to speed with information that is timely and impacts their lives with other illnesses outside of COVID. And again, like I said 2 or 3 months ago, I think less is more. I think if you put this out there once a week, it gets a 24-hour news cycle with the media. They put it out there and say, here's what happened in the last 7 days in Macon County. Here's what the cases were, everything else. Everybody gets it. That's great information, and move on to something else. As far as the medical people go, I got no problem if the health department wants to send them out a weekly or daily release of information, but because the media is picking up on this, and they're just, I mean, I sat down and counted one day between the newspaper and the TV station, there was like 40 postings in 24 hours on COVID statistics that are coming from the health department. It's just overwhelming. So, and I've heard from a lot of other people, so that's why I brought it up.
So what would the board members would like to look at? I don't look at the website, the content of this website. I know there are daily press releases, but what would you like to look at, Amanda? Do you like to look at the hospitalizations, unvaccinated, vaccinated, unboosted, unboosted? You would like to look at those numbers to?
I think that's valuable information that needs to be shared with the public, because a lot of people keep asking questions. I mean, I read a story the other day and they're talking about the percentage of people that were in a particular place, and they said that this many people had already been vaccinated, fully vaccinated, and had their booster. And I mean, I just listened to a guy the other day, and doctor, you're obviously knowledgeable about these types of things, but this guy was talking about the other day, talking about that all of a sudden, and I don't know where it's going, but all of a sudden they said that the CDC is now kind of withdrawing their support or recommendation, I forget how they kind of phrased it, of the Johnson & Johnson vaccine because of issues, and they're not pushing that one. So now all of a sudden, does the public know about that? Maybe those are the type of things that we need to be talking about to the public and educate the public. Like, again, I don't know, is that a problem? You're steering business to one company or another? I don't know, but this guy seemed to know what he was talking about, and the statistics are there. And if it's coming from the CDC, again, they're the ones that are driving a lot of the conversation surrounding this particular illness. If the CDC saying we don't think you should be getting a Johnson & Johnson vaccine because these reasons why, I think we need to be educating the public about it, because I haven't heard anybody talk about it. I haven't heard it discussed here in this facility.
That's a good point, but the issue is that I don't think the health department itself can endorse a certain vaccine. They had to lay out the facts, and the public individuals can make their recommendation. But yeah, they probably need to know the information why the CDC is not in favor of.
But I mean, are you aware of that as legitimate? Is that legitimately the CDC saying
I mean,
that?
again, it's a matter of numbers again. Few individuals have died because of the problems with clotting associated with Johnson & Johnson vaccine. But that's significant enough. I mean, if you look at the stats, it's not. But if you look at the patient in particular, or the individual in particular, or their family in particular, to them it's 100% or zero. So you got to lay out the facts, and there are certain type of patients who have reactions to the Pfizer or the Moderna vaccine. So then the only recourse to them is the Johnson & Johnson vaccine, and be able to deal with the adverse effects that happen with Johnson & Johnson. So there are certain, it's coming less. The Johnson & Johnson vaccine is not being favored as much as it was earlier because it's a one-time dose before we got to the boosters. But now there may be certain patient population that can only take this Johnson & Johnson vaccine for whatever reasons. Those are the patients that will be taking the Johnson & Johnson vaccine. But as far as the clotting problem is concerned, the CDC believes that the number of problems with Johnson & Johnson is high enough to let the public know about it. They can make the recommendation. So I don't know if the health department can put out a statement there, but obviously the information can be there based on the CDC guidelines.
So are we gonna make a motion on this or just discussion, or where are we at with this then? I'd like to know.
Yeah, if we can, I'm all for it. I think less, I totally agree, less is more. And the other thing is, if you're into the marketing realm and you want people's attention, we gotta change the format, what gets sent out, because everyone's used to seeing that, and honestly, I don't know how much they look at it besides if we have to look at specific numbers. The average person's, it's over the top of it. So if we wanna do it, we need to be changing it, the format on a timely basis to get people's attention. Because if it's the same old thing, it's the same old thing.
Maybe something new, descriptive, something that is
Different graphs than what we've been using,
to
change it up.
refer to COVID, like a new, like a new, what do I want to say? Like
So-
something that, a new symptom, that someone come up with, put that, like, maybe
Well,
some new
that's part of
symptoms
what Dr.
or.
Manigotti's saying too, which
Yeah.
I feel pretty strongly about that too. So I would make a motion that we direct staff to go to weekly press releases, which would include the following information. Drop the overall case thing. Like you said, nobody wants to hear that anymore. Hospitalizations, people that are positive cases, people that are cases breakdown. That's why I think is the next big thing that really has people's interested is showing the number of cases of vaccinated versus unvaccinated. And split and have that information to show people that have gotten COVID that were vaccinated. Because I think that people think that, if we tell everybody that they're getting COVID after they've been vaccinated, that's a deterrent for people not to get vaccinated. I don't agree because I've heard different stories. I got a friend of mine, she works at the hospital, she got vaccinated. She's gotten COVID since she got vaccinated, but she said it wasn't nearly as bad. So we can educate people on the fact that, hey, even if you get vaccinated and you do contract COVID again, the seriousness of the illness may not be as severe. I think we need to change our strategy on what we do, but I also think we need to put real, straightforward and honest statistics out there. I think we sometimes think the public is not as smart as we think that we are. And I think that's a discredit to the public at large because people do a lot of research. And unfortunately, with the internet nowadays, they do a lot of research.
The other question I've been hearing from people is also, if we're getting tested, how, if the testing's good enough, are we knowing if it's the Delta variant, the original variant, the Delta variant, the Omicron variant? Do we know that information? And if we know that, that would be something we're
Right.
putting on there
That
too.
was what I was.
That's gonna get people's attention. Because, all we're hearing now is Omicron, but what about the Delta that was just here a few months ago? I haven't heard anybody who has the Delta now.
Well, and it was only, what, two or 3 weeks ago, they said there's only one Omicron case in the whole state of Illinois, and all of a sudden it's.
The first case came over on December 1st, 2021. That's state of Illinois.
Yeah.
So it's only less than 3 weeks that the entire nation is about 73%.
Because, honestly, the public should know that Omicron is not as severe as the other ones. So it's actually, that's actually a good news thing. If you'd rather, that's a much better news thing. It's not
We've been talking
nearly
about
as
it,
severe.
and it's been quite a bit talked about being not as much severe as Delta, but more transmissible.
Correct, yep.
But again,
Heard that.
they are not sure about, they're still waiting on the exact words, how to define this. So I don't know if we can put the information that's still in a fluid state on the website and make it on the health department and say, this is what it is now, until we get the final, a true picture of this Omicron variant as to what it's going to be, which I'm sure it will define itself.
If someone
in the next
gets
couple of
tested,
weeks. I'm sorry.
if someone gets tested, do we know which variant they have?
In the hospitals, they're not testing, but it's up to again, the public health department, the IDPH that does this testing. We don't have, all we have is the COVID positive or not negative in the hospital. And the IDPH comes in at some point in time and says, okay, we're going to, go ahead, Brandy, get it.
You're good. You're doing a great job.
So the IDPH will come at a certain point in time because of the surge or whatever we have, and then they say, okay, now we're going to take this. That's what happened in July for Delta variant, before it was the Alpha, and whatever we had before that. So it's at that point in time, because of the lack of resources, it's the health departments that come in and say, we're going to test this, we want to see whatever community level is for this particular type of variant. The hospitals don't have a say in that, other than presenting the cases, or the cluster of cases saying this is what happened in a household or a community. That's when the health department takes over.
And the tests that are done, how many, like, if we have 100 tests done, how many of those are actually tested for all the different variants?
I'm sorry?
What percentage of the ones that are tests that are given and are positive are actually tested for which variant they are?
I don't know how many tests are they're doing in the hospital, but I get all the positive results, and then
You don't know if all those are.
like since this morning, they're all Delta, and they're all presumed to be Delta. We don't really check to see if they're Delta or Omicron right now. But as of this morning, since this morning, I probably had about 11 or 12 cases. I'm talking about DMH, I can't talk about St. Mary's. I don't have access to their system. So.
Can you?
So you want me to propose a motion that we do weekly press releases, which would include the following information.
Okay.
Current positive cases, hospitalized, COVID deaths, which I think we still need to include that. And then vaccinate, out of those cases, including positive cases and hospitalized cases, the percent which is vaccinated and non-vaccinated COVID cases.
And one other step on that one, because that's what other people said about, if we're talking about COVID deaths, we really need to have the COVID deaths with other health issues versus healthy people. There is a big difference between the two. There's a difference between dying from COVID and dying with.
Yeah, this has come out many months ago when the CDC talked about it, with and from, it's quite a bit of difference. There's always a problem in associating or attributing the death to COVID, because not only on the infection control professionals in the hospital, the nursing staff, the doctors, the hospitalists, but I think it really needs, as an infectious disease physician, I can go into the chart. I don't see all the patients that come with COVID to the Cape Memorial Hospital, but I review most of the cases. I can pinpoint and say when the infection control is leading in a certain way, say this is dying with COVID versus from COVID. I can, based on whatever little experience I have with infectious disease, I can say this is not COVID, this is actually a bacterial pneumonia. So I have interacted in certain cases. Yes, there is always a problem there, but in some hospitals where you don't have the expertise of someone who can oversee these cases, everything will be attributed to COVID. Yes.
It's a challenge for you to kind of separate the pies.
It's a challenge because you need a certain way, you need time and expertise to go into this. Although I don't see certain patients, I can for sure tell my infection control professional, this is not COVID, this is bacterial pneumonia. And he died because there are other problems, not from COVID.
Well, I'm hearing in some cases too, it's a challenge for families when they're getting a death certificate and stuff. And I just heard a story the other day where, you know, they were told, this is what we decided it is, so that's how it's gonna go on the death certificate. But like you said, they had a lot of other underlying issues that kind of led up to that. And I don't know at the end of the day, you know, we're all gonna die of something. I don't know if it makes any difference unless it's a insurance related issue for benefits or something like that that has an impact on the determining factor of cause of death. And I don't know if that's maybe what's driving some of those conversations now or not.
Yeah, I
don't
can't
know.
speak the financial aspect of that, unfortunately, but from a functional, from an infectious disease standpoint, I can tell you that, yes, there are certain things.
We just, you know, the big thing that people have talked to me about is the fact that everyone knows that when the hospitals were shut down, that if there was COVID, the government was giving them cash. And so in other words, it would be great if we got to the point where we were honestly telling people how many people were truly COVID and not just a financial thing.
Yeah.
And right now, I don't think the public believes the numbers that are coming out.
Which is why the health department has taken the responsibility of communicating the numbers daily to continue to reinforce that. I feel like they've done their due diligence of keeping people informed, because there are still people out there with as many questions as you guys have about COVID and the impact. And if they don't keep it out in front of people, people will, I mean, I know you think that you're inundated with numbers and data, but you still have questions. I mean, and COVID isn't going away right now. It's a pandemic, and that's why that's what you're hearing about. You're not hearing about HIV because it was a pandemic. It was a problem at one point, and now it's controlled. Same with the flu. We're not seeing the flu because all we're seeing now is COVID, and flu didn't spread last year like it normally did. But I think the health department has done a great job of keeping people communicating to and informed so that they can make decisions, you know, to get vaccinated and to see the horrible impact that it's had.
Yeah, don't take this the wrong way. I'm not saying the health department is doing anything wrong. What I'm saying is it'd be great if we get true information out to the public, is what I'm trying to say. This is not a slap against the health
Well, it just
department
sounded
whatsoever.
like you didn't want to hear the numbers anymore. You just want to hear them weekly because you're inundated with the numbers, but.
It's not
We
what
would
the
have
health
inundated
department's
the
doing,
people.
it's what the media is doing when
Right.
they take that information and they keep recycling it over and over. And
Right.
the only way we're gonna be able to slow that down, and again, less is more, and get people to start paying attention again, if they don't hear it constantly 24 hours a day, and then they do hear it, if the media decides to take a weekly report and talk about it for the next 7 days, there's nothing we can do about it. But we can focus the message on, this is what we got in front of us. These are the other things that we're bringing to your attention. By the way, this many cases were vaccinated, not vaccinated. People will start picking up on that. I think that people just, you know.
Well, to expound upon what you're saying, the perfect example is if we tracked for the last 10 years, every year on the flu, this exact same numbers, people would be overwhelmed and do that. We'd have the same numbers out there. We'd have people who died from flu. We'd have people, how many got the flu shot, how many didn't get the flu shot. It's the same scenario.
Right.
And if we track this every year, you'd be able to tell us the same thing. We would be talking about this every year. If we truly put out the numbers to the people every year about the flu, it'd been the same stuff.
And I think the reason that it's COVID is because we're still in the pandemic and it still continues to surge in people.
And other people's point is we have the flu every year.
And we never
And it
historically
changes.
have done reporting.
We've
like that.
never tracked it like this. That's the difference. Never tracked it like this. Because we could have tracked it like this.
How long has the
if the goal is to not be inundated or, using staff resources on something that's already being done, then we would just forward people to IDPH for that piece. As far as current positive cases, hospitalized, and deaths, that's all local, and we've got that part. But that was my question, is just about that, percentage of positive that are vaccinated versus and just kind of letting IDPH handle that
I
as it
get what you're
happens.
saying there, but I think again, people want to know what's going on in Macon County. So if you have that access to that information, whether it comes to us through IDPH or you're collecting that information, I don't care about how it's getting delivered. But I think it's important, as Dr. Jerger was talking about, that we put some different pieces of the puzzle here together for the public to see, because I look at the charts. I mean, I do, I check them, and I want to know, this is what we got, if you wanted to break it down, not that anybody may care or not care, how many cases that are hospitalized are going to St. Mary's or Macon County, or they're going out of county. I don't want to add more to this than what it is. But again, I appreciate where Vivian's coming. Everyone's got different points of view on this. But again, I'm trying to get people to, when they hear this, it's a news story. If we talked about what caused things to go boom today, as they did on social media for the last 12 hours, and speculate on what it was, and we talk about that again tomorrow and the next day, or else after a day or so, it's gone. People aren't paying attention to it anymore. And I think if we put some new statistics on there and how we approach it and release that information to the public and to the media, I think now it becomes a story where they will focus time and energy on it and talk about it, because the frequency is decreased. Now maybe it's got a stronger message and got people kind of perking ears up and like, I haven't heard about that, okay. And they listen to it more intently. It may make a change. I don't know, but I think after almost 2 years, I think it's time to try to do something different.
Okay.
So Randy, do you have some information of like the 45 in the hospital or something today, something in 40? Do you know how many of those are vaccinated versus unvaccinated?
So that's what I'm sitting here trying to figure out logistically. So we've relied on the hospitals, each day they are to submit a report to us of how many they have hospitalized. Because if someone's in the hospital, we may not be able to reach them, obviously, to even talk to them and find out where they are isolated. So we get the reports from the hospital and then cross-check it with the file that we keep that has the status of everyone, which is what we use for our local report.
You get the information if they're vaccinated or not?
That does not come in. So what we do is we do check for every case when we're doing case investigation of if they're vaccinated or not, and then we log in the report of whether they're vaccinated or not. We check iCare, which is the state program where vaccines are logged. And so that is not something we have readily available. We don't have an epidemiologist to handle that part of the reporting. So I can definitely refer the vaccinated versus unvaccinated overall. We can use that IDPH information. What might be harder to get quickly and figure out is us being able to be the reporting agent for how many of those hospitalized people are vaccinated versus unvaccinated, especially as they go to this transition with the surge center. So if the board is fine with it, we can make this change to weekly this week. I mean, we can do one. We were not going to do it on the holidays anyway, and we're already not doing them on the weekend. But we can do one this week, which would basically be, let's say it's Tuesday. So do one Thursday, or even do it tomorrow for where we are currently, and then do one next week. We can definitely make immediate changes for the things that we have immediately at our fingertips. But with the conversation of kind of changing the graphics, maybe doing a different format, I would ask the board's permission can we make that part effective maybe like the first week of January? So then that way we do have time for us to all review. Does this look good? Is this something that if people have visual impairment that they can see it? Because that's something that was taken into account when we did those graphs and coloring and all of that. So I want to be aware of that, and on top of that, and then figuring out if we can be the reporting agent for how many hospitalized or vaccinated versus unvaccinated.
Yeah,
So
as far as the vaccination versus unvaccination concerned, who is our point person at DMH, for example? If you need to get how many patients are hospitalized, how do you get that information?
I don't know who they're talking to at this current moment, but they have someone at both hospitals. It's changed, so I don't want to say the wrong person's name.
Probably infection control.
But And then,
It's the infection preventionist. Hi, this is Rachel. I'll be joining you guys here in a little bit. Dr. Menegatti, we get it directly from the infection preventionist at both hospitals.
You have access to the vaccine information. So because I see that every single day, all the COVID patients, they're on the list. I have access to that information. That means they have access to that information. I know who is vaccinated, who is boosted, who is unboosted. I know that every single day.
so maybe we could just ask them to add that to their report, and then that'll take time for them to transition. So we can notify them of that as soon as tomorrow, that we would like that
There's
to
the
be
one
added.
caveat, I mean, all the positives in the hospital or all the patients are not from Macon County.
Right, right. And they figured all that out, because we're just reporting on local, so they do just send us the local information. So that's something that we got figured out a while ago, and the hospitals have been really great to get that to us. And I'm sure they'll be grateful
So
to
you
not.
can collect that information he's talking about, you could collect that at the end of each week and then put a report out the following week on Monday or something like that, for example.
Yeah, and that would be the easier way,
Yeah.
especially if Surge Center is taking, and then we have to log all that. Like I said, we don't have an epidemiologist, so that might be the way that we can actually get that done. So just make sure I understand what's being voted on. Do a weekly with current positives, number of cases hospitalized, vaccinated versus unvaccinated, and then the deaths for local, and looking at changes in format and coloring, description, et cetera, moving forward. Is there anything I missed?
That covers it.
Variants. Oh, I did want to say, we have been putting variant numbers out. So if you've missed those, they have put them out, and maybe it gets lost because it does look similar. And maybe if it's, the one day a week, people will see that more, but we have been putting that out, and we will continue to do that as well.
I've seen that.
Yeah,
Yeah.
so I'll make sure, thank you for pointing out, but I'll make
And
sure
somebody explained that to us. It's a sampling, and the state does that, and that's how they come up with the numbers. It's not every.
Right, they don't sequence every single one, and you won't know right when you test what strain you have, and it takes a while. A lot of times people are even out of isolation before they know if they had a variant strain or, what strain they had. So we could definitely put that out, and having the weekly expectation, I think is definitely reasonable with that as well.
So we're talking about the press release being once a month. Is there, or what's a part of it? Is there still a dashboard? If somebody wanted to log into your system, they still have the ability to look at a dashboard that's got the daily numbers for somebody?
You mean my staff?
No, well, the public. Can the public log into your system and get a daily dashboard of all those numbers? No.
If
Okay.
we're not, so the piece that I think you're speaking to, Mark, as far as the staff time and staff resource that goes into that. So we have team leads, they log all of the information for each case. And then all of that is tallied and figured by our health promotion team. And that is the group that does the announcements, the website, all of that. So if that stuff is not analyzed and put into some kind of reportable document or graph or chart or whatever, then the public would not be able to get it every single day. The CDC website, that COVID data tracker, that one is fairly recent and gets updated fairly often. So we can certainly refer people to that want a more daily update. But if our staff do all of that every day, they'll just basically be skipping put the report out to the media stuff. So there won't really be a savings of staff time if that's one of the goals. But we can certainly keep referring people to the CDC data.
I won't repeat all of them, you guys heard them.
I got the bullet points.
I'll second.
Okay, so motion in second. Roll call vote.
Vivian Goodman,
No, I still want my daily.
I'm sorry.
No.
Mark Scranton,
Yes.
Sue Krause,
Yes.
Candy Clevenger,
No.
Jeff Endler,
Yes.
Debbie Hill.
Yes.
Dr. Brett Jerger,
Yes.
Dr. Venkat Miniganti,
Can I say no and yes? No, I guess not.
Cody Parks.
Yes.
Alright, I guess the motion carried. Alright, moving on to new business. Alright,
approval of the Macon County Board resolution establishing fees for cottage food operation, registration, and inspection.
Okay, so this was in your packet, and this was something that Kathy worked on and worked through it with Mike Baggett. I did have him review the wording so that I could make sure that was correct. Kathy is here tonight, so if you have a question for her, you can certainly ask that now, but this would like to request your review and approval on that.
Or anything like that, you gotta go through a lot more requirements, you pay a lot more in fees to be able to produce a food product regardless of whether it's, baked goods or meats or whatever. Are we opening up the door here to more exposure by passing this, number one? Number two, I'm looking at it, and if I read the information correctly that had been provided, that the state basically determined what the registration fee was gonna be for this, is that correct?
So basically, we don't have a choice. It is a Senate bill that goes into effect January 1st. So what I'm asking for with the resolution is to be able to charge the fee for when that individual applies to register as a cottage food operator. And then also, if in the case of an outbreak and or a complaint, we charge a fee to that operator to go into their home to do the inspection. It's a Senate bill. We cannot not do it. We have to accept it.
We have to accept the fee.
No. We can only charge, the way that the Senate bill is written, we can only charge up to $50 for that registration.
Right, I understand that.
Other than that, the fee is, we can set it wherever we want, and then of course the inspection or investigation fee. What I did put in there is that those in Region 6, which is our region, we are all going to stick with charging $50, so it's fair across the board in this area per county. And then I gave you just kind of an idea that when we had the swimming pool ordinance back in 2009, we set $100 for any investigation or inspection based for complaints. And I figured since 2009 to 2021, we go up to 150 because this is going to take multiple. If this were to happen, it would take multiple of my staff to handle this type of investigation.
Well, my concern is, again, other businesses have to do more training, more expenses, both on the front end with equipment and subject to inspections and things like that. I guess the problem I've got with this whole thing is, I think it creates somewhat of an unlevel playing field. I know there's been a long time tradition of, people doing baked goods and things like that, but now we're in a different world where we worry about what something's doing. I remember years ago, we had the turkey dinner that the church did every year, and one of the things that they were told was, they're baking pies, so they bring pumpkin pies in, it's like, okay, you can't do this because you don't know where it came from, you don't know if it was cooked at the right temperature. To me, this creates a lot of work, and when you're only able to charge a $50 fee, when we cut a lot bigger things on our plate that I think the health department needs to be taking care of, I question whether or not we should be even allowing this to even be current in the first place. I mean, if we had the ability to raise the fee, I might feel a little bit differently about it. But I feel if you go to, a local restaurant and say, okay, you're baking cookies, but you're also doing this stuff, so they're having to invest more money in equipment. I think, somebody doing this in their home, the sanitation aspect of it and everything else, you got no way to determine that. You don't have the time, your staff doesn't have the time to go to 4,000 homes in Macon County and say, I want to see how you're baking your cookies. I think, and it's not so much concern from a health standpoint as exposure liability as much as it is just a perception that, like, for $50, I can open up a cottage food business out of my house, but if I wanted to grow that business beyond a certain point, now all of a sudden I've got to go out and invest thousands of dollars in equipment. I got to have a kitchen with NSF equipment. It's going to be a commercial kitchen, licensed and everything else. That's an enormous expense to maybe grow what maybe started out as a little mom and pop operation. I don't know. I really got mixed emotions about this. And part of it is the fact that we're being restricted on what we can charge, because I think if you had the fee higher, you'd probably have a lot less people, apply for this. But I guess at the same time, if people choose not to do this, they're going to keep doing what they've been doing for the last 100 years and just make stuff and take it anyway.
So if you go back, step back, it's happening no matter what.
So yeah, we currently already register cottage food operators under the current set of rules. I think we have maybe 2 or 3 this year. So what we're doing is, because we have a new set of rules with new stipulations that where I may have to be reviewing food safety plans or lab results or those kinds of things, that's where we're wanting to start charging. We've always had the ability to charge to register a cottage food operator. We just never have. Just simply because before it was just a piece of paper. You fill out your name, you tell me what you're gonna do, I talk with you about it. You're only allowed to sell at a farmer's market and you're done.
So it might mean, what did the sentence say is happening January 1?
So starting in January 1, the list of foods is going to be increased into what they can and can't sell.
Okay,
So that's gonna be a big increase. The other
so
thing,
that's a given no matter what.
that's a given, no matter
So-
what.
My only concern is the same one. Are you charging enough?
Unfortunately, the way that the Senate bill is written, we are only allowed to charge a maximum of $50.
Okay, but then you said you can charge something on the other side.
So if, let's say, you went and you bought cupcakes and your staff got ill, if you were to make a complaint to the health department that, hey, I ordered cakes
So we
from
can
Kathy's
control that
Cakes,
amount.
I would go do an investigation,
But
and that's where
but
that
we control that amount,
$150.
right?
Yes, we control that amount.
So no, we're not limited to the 150.
No,
So that's why I'm saying, are we truly charging enough? Because if you have to go in and do it, why are we?
It's not more than $50 for staff to fill the paperwork out. That's my whole thing.
I'm saying I want to help you guys.
Right.
Is that enough? I mean, don't start on the low side. I mean, if it's realistic that you got to do these things and it's a lot more thing, why are we only doing that number? Why are you not going to go with a little bit higher number?
because I'm gonna be on the proactive side and say that we're not gonna have any investigations like that. We haven't had any to date yet, so that's why. I mean, and that's something that if you guys want to start it higher, then you direct me to start it higher and I gladly will.
So what's the current fee for re-inspecting a food truck or restaurant?
It depends. If it's not a priority, there is no fee for re-inspections. It's only if there's a priority violation and it's $75.
Is that something we control?
That is. That is.
Seems like we need to look at a lot of those things.
I will tell you that all of our fees have not been touched since 2015.
I think that's what we need.
I think
we have that look for next month.
We briefly talked about this one other time, because I remember trying to correlate it to a person's loaded salary, and I agree, but it's not enough.
That's not covering anything that you would come close to.
How long it would take you, let's just, for the sake of conversation here, how long would, if you had to go out to Kathy's Cookies? Sorry, couldn't resist. Gotta go out and see Kathy's Cookies because you got a complaint. How much time are you gonna expel going to do a basic investigation?
In the home or all of the pre-work to even get into the home?
What would clarify
A lot.
your
In the
inspection
home.
and investigation?
In the home, I would say probably easily on the minimum side, an hour, probably closer to 2 hours. That's not including the pre-work of trying to talk with the person to figure out, let's see your recipes, let's see your processes, that kind of stuff. So you're looking for one complaint investigation on something to this extent, you're probably looking at, 5 to 10 hours.
So if it's a day's time, my time's worth $75 an hour, then I did place a value on that. I would not object to the overall resolution, other than the fact we got to charge for the registration. I'm telling you right now, if you're gonna do inspection, I don't want to see you going out there for less than $500. I'll just give you my honest opinion, because I don't want you spending your time when you guys come and tell us that we don't have time to go and do these other tasks for regular commercial customers, and you've got all these other things on your plate. Now you're adding this to it, and you're gonna stop doing something else and go take care of this, because there's no revenue in this. We're actually losing money if you or your staff goes out to deal with one of these problems. Whether it's unfounded or not, that's to be determined. And I don't know at what point you say, I'm doing inspection and investigation. They're kind of go hand in hand, they're one and the same. I think that should be a $500 fee. That's just my opinion, because I think there needs to be some level of accountability to hold these people to the same standards that a person that has invested a lot of money, as I said, in having NSF compliant equipment and doing all the other things that they gotta jump through for their food truck or whatever. There's a gal out there I know that does cookies. She's got a food truck, okay? She has to go through the same thing that everybody else has to do, regardless of the product they're selling. But yet she's got a lot of money invested in her business. She's at risk. A person that's doing this out of their home has got a lot less risk. But we need to put some teeth into this thing and say, look, if you want to do this, we're going to let you do it. But if you make a mistake here, there's going to be costs associated with it. That's just, I think that's what Dr. Jurgen's alluding to do, because I'm not interested in spending staff's time doing something that puts us into a negative hole. And if you don't have any cases, then it doesn't really matter. But if this comes out and everybody says, well, gosh, I can get registered, it's only $50. And all of a sudden you got 20, 30 people doing this. And if you have one of these things happen, it's gonna cost you more money than what you collected in fees to start with.
Again, you guys tell me what fee you'd like to see on that resolution and I will gladly change it.
You want to have suggestions?
Yeah, I'm asking you, what do you think?
Oh,
I'm asking you for a reason, and you know why,
Am I
because,
allowed to discuss this because I'm affiliated with the restaurant?
well, you're in the business, so you should have an opinion about, you know,
Am I allowed to discuss it?
Scott, what do you?
What she said earlier. We're talking about the cottage food industry, right? So it's different from what you do, it's
Right.
at the home. So
Yeah,
you're
because
restaurateur.
it could be severe. She's wasting a lot of hours, not wasting, but spending a lot of hours for something so minimal. I mean, that's.
but if you gotta trace something back, there's a
Exactly.
foodborne illness back to your business.
Exactly, and
You go in
it
there, look at
takes
one thing,
time.
if you sell a bunch of
takes
stuff at a
time.
church bazaar or whatever the case may be. I mean, I can remember when I was in school, we made some special brownies that weren't supposed to be made. You know, how do you go back and trace this stuff back? You know, it's gonna require, as
It's
Kathy
been
said, it's
going
gonna
on
require a
for
lot more
years.
time.
It has been going on for years, but it's becoming so, we need to really slow it down. Because if you hear one person, oh, we're doing this, oh, we're doing this, now everybody wants to do
Yeah,
it.
and
Just like the
I will
food
tell you holidays, like right now, the amount of Chex Mixes I've seen, the amount of peanut brittle I've seen, all of that should be under cottage food.
Should.
So is everyone okay with raising
Yes.
the fee and bringing it back, next month? Well, it goes into effect February 1st. You have to go to the county board with this as well?
Yeah, so the Senate bill goes into effect January 1st.
Oh.
I believe it can be amended though, right, Scott? Can they amend the fee in this resolution before they vote or no?
In the past year.
Right.
Yeah, sure, anybody can make a motion to amend the resolution anytime before. You can even make a motion to introduce a new resolution replacing the old one if you already passed it. It's not.
We can amend
Change
this.
it depending on the will of the board.
But back to what she was saying earlier also about if it directly impacts that person, we can talk about it, we just can't vote on it, is that right?
If it directly impacts you, you're not actually supposed to be involved in the discussion, the
So,
board discussion of it.
so nothing
Or
medical
vote on
or
it.
nothing, if it's food related, she can't talk about it, if it's septic related, I can't talk about it, if it's medical related, they can't talk about it. So,
No,
No.
it's more specific than
okay.
that.
I'm just wanting to make sure, because she was asking also, that was kind of confusing how you said that.
What we're
Right, but
talking-
it's Scott clarified.
Okay.
Okay.
Yeah,
What we're talking about is the specific bylaws of this board. Because normally, even if you are a board member that should abstain from a vote, say you are, we take a real world example. Mr. Craig on the county board, his mother is an employee of the circuit clerk's office. So when it comes to like funding issues for the circuit clerk's office, Mr. Craig abstains because he doesn't want to be seen as improperly voting on funding for his mom's pay raise or whatever. Perfectly, that's perfectly right. That doesn't mean he can't put his 2 cents in, okay? However, your county board, your Board of Health rules specifically say that if you have a conflict on an issue, you cannot discuss that issue during discussion of the resolution, okay? So what Mike Baggett said earlier today, in answer to Ms. Binkley's question, was there is also the issue, though, that in terms of freedom of speech, as a member of the board, you can have opinions about things, but the proper place, because of your board rules, to say anything about those would be in open comments by board members, okay? So, and that's kind of, to look at it mechanically, it's kind of hard to figure out, because you may have already considered the resolution and not been able to say anything that's already voted on by the time you get to make public comment. So there's a disconnect there. I don't know if the board would want to, so they get people's information, because, like, for example, even though Debbie here, let's see, sorry, is a restaurateur, if there's an issue that's going to affect fees to people involved in the restaurant business, that would be something by your rules she would not be allowed to speak on while it's being discussed.
Right.
Okay. But she certainly has a lot of information as a member of the board.
Yeah.
So I don't know if the board wants to consider changing that particular rule. I understand perhaps why it's there. Or the other option is to, during the course of discussion, officially ask for public comment. And that gives people an opportunity to give their input. But the way it stands now, your specific bylaws say anybody with an interest that is compromises their ability to be part of the vote can't even discuss it, which is pretty goofy in my mind, but that's the way it is. So.
Yeah.
So does that make that clear as mud?
Because they can give out the good information.
So, but the way Kathy, to get back to this, the way Kathy's got this written up, this is a resolution for us to vote on that's then going to go to EHW committee to vote on in January, then the finance committee, then it'll end up in front of the county board. So we have the ability to amend this resolution as it stands right now. So I'm going to make a motion that we accept this resolution as presented, with the exception that the inspection fee be changed to a fee of $500. That's my motion.
That's just a one-time fee, whatever they, more or less.
No, it's every time they go.
No, every time they go back out, yeah.
Yeah.
So every would have a complaint made regarding Kathy's cookies. Every time a complaint was made, Kathy's Cookies would pay the $500.
So if someone doesn't like Kathy,
So
they can
retaliation.
complain, and Kathy has to pay $500
Yeah,
for,
to the bank, right?
Correct.
even though you don't
How
find
would
anything.
you do
Wow.
that then?
It gets confusing there.
Could it just be if it's founded or something? Because, yeah, you could have disgruntled anybody
Well, I
sending us out there over and over.
that's what we do right now with restaurants.
I was gonna say,
We
you can do the same thing against,
Oh.
I mean, I can say the same thing against you every time, and they just have to keep coming out, right?
Do you think that's too high? I mean, give me feedback.
I think, can you leave it to the discretion of the inspector, to say it was founded, or, you know?
Well, this has to be passed by 4 different
I
bodies,
understand,
so
yeah.
you gotta have a dollar amount next to it.
Do you mean discretion though, of whether or not it's charged? Is that what
Yes,
you mean?
that's what I was asking.
I mean, that's, I guess, what I was asking too, is if we just go out there because someone complains, that there's maybe a, a minimal inspection fee, but then if it's founded, if there's a priority finding or something, they would get fined the full 500 or whatever.
Keep in mind with that train of thought, that when I walk into a home kitchen, it's already failing an FDA inspection.
Yeah, absolutely.
There's no way it could pass. And that's just me being 100% honest. There is no way a home kitchen would ever pass an FDA inspection report. And that's what we have to use currently. There is, part of what the state is doing is coming up with an investigation form so that everybody's looking at everything similar throughout the entire state of Illinois. But if you can ask Rachel and Amber trying to say that, yes, it's founded because there is a foodborne illness, or no, there's not, that's gonna be just true, slim chance also, because there's so much testing that has to go on.
So-
Seems pretty confusing, really.
We have the option to, if we approve it, we have the option to amend it later, correct, Scott?
I'm sorry?
If we approve it as it is, we have the option to amend it later? Is that what you said
Sure,
earlier?
you can always, at a later time, someone can make a motion to amend the previously passed ordinance to now read such and such. You could, as a legislative body, you can always go and change whatever it is you've done.
Scott, correct me if I'm wrong,
It's
maybe
better not to
the
do that.
easier way to look at this is that
sorry.
initially, we did resolutions for all of our fees, so whether it's a restaurant fee, a septic fee, or whatnot. But in our ordinance, it does give you guys, as the Board of Health, the ability to change those fees at any time. So I think, and Scott, if I'm totally off base, please let me know, that this resolution is just giving us the ability to charge a fee to get it out there on the table, because we haven't charged a fee ever before. And then if we decide next year that, hey, we saw a lot of complaint investigations with this or whatnot, we can revisit and adjust the fee at that point. Am I off on that one?
That's where I was going.
Well, and that's a good point. So do we have to run through 4 different bodies?
Oh, sure,
Amend the
yeah.
fee all over again?
Yeah, absolutely. If
So
you change
put
it,
that
then
through
it's gonna
everybody.
have to follow the
So
same
let's just come up
process.
with an amount to start with and not have to bring this back. If
Because
somebody doesn't like $500, I'm open to ideas, but if she's staying 5 to 10 hours, I mean, even if it's 5 hours a time,
But she also said they haven't had any problems, any
yeah,
complaints.
but this may increase, we don't know.
Once they,
$375 if you go there for 5 hours. If you got 5 hours invested, you got $375 time, of value of your time or your staff's time tied up in it,
well,
so.
if you think 500 sounds awful, then do 375 or 250.
I'm only one person here,
Something-
everybody else can express an
Something
opinion
that
on
will
all of that
shock
too.
them and make them do things the
Right.
right
And
way.
it's
That's
one
kind of
fifty
what I
now,
was
right?
headed with.
The
Right,
resolution.
Right, the resolution is
150.
150
But it's 75 right now for the,
for a regular restaurant.
Yes, but it was
But the
zero
restaurant's held
for,
to a higher standard to start with because of what they have to do for training and resources and everything else they have to have to get.
yeah, but if they've had an investigation that it costs the same amount to go out there and inspect everything.
Well, but we're gonna possibly
Yeah.
talk about that,
Everything.
everything, all the.
We're gonna bump.
so we're going from 0, guys, to whatever number you're coming up with. So 0 to 500 does, I mean, to me, that's a bit much.
So, 350,
350, that's splitting the difference.
I'm good with
is
that.
that good?
Is that gonna be for just this only, or restaurants
No, this is
and?
for the
That's
cottage
just for the
food.
Just
cottage
this one.
food.
But we need to,
And well, until we change the fees and everything else.
So-
Logically, if you think it's gonna cost this much for this, you do the same thing with the other one.
It's more.
So I'll
dangerous at home.
rephrase my statement then, that I make a motion that we pass the resolution with the exception of raising the inspection fee to $350.
Second.
Roll call vote.
Vivian Goodman,
Okay, so I'm passing with, I still think it should be 250, but, sure, passing. Yes.
Mark Scranton,
Yes.
Sue Cross.
Yes.
Candy Clevenger. Jeff Emmett.
Yes.
Debbie Hill,
Yes,
Dr. Brett Jerger,
yes,
Cody Parks.
Yes.
Okay, motion carried, thank you.
Thank you.
Approval of MICHD ARP resolution.
All right, I'll take this one. This goes along with the McWee grant program we have had for several years. McWee stands for Maternal Infant Early Childhood Home Visiting Program, just if you're curious. So this is some funding that is part of the American Rescue Plan Act. And it is dollars that can only be spent to currently enrolled McWee families residing in at-risk communities, and the following allowable purchases: technology, emergency supplies, and prepaid grocery cards. And it is for $15,137.
Any questions? All right,
How do you guys administer this program? I mean, who makes the determination that people meet the criteria?
The entire home visiting program,
You know,
that is all dictated by the grant funding. So McV is like an overarching, we have McV coordinated intake, which is part of our Wicked Family Case Management Division. They're kind of like the coordinated point of intake, where if people need services, they're referred to them, and then they refer out to the community, not just to our McV program here internally, which is part of our nursing division. They have to be separate, but and other entities in the community. So basically, they determine through an intake process which agency services would be most fitting for the family, and then they refer to the appropriate agency. Our agency, our McV section is just one of those. And so the grant funders basically dictate what the criteria are for people to be able to receive those services at all, or anything that would be involved in those. But,
thank you.
any other questions? Entertain a motion to approve.
So moved.
Okay.
Thank you. Roll call vote.
Vivian Goodman. Approved. Mark Scranton.
Approved.
Sue Krause. Approved. Candy Clevenger. Jeff Edler.
Approved.
Debbie Hill.
Approved.
Dr. Brett Jordan.
Yes.
Okay, motion carried. Thank you. STI clinic updates.
all right, so you did have an outline in your packet this month. As requested last month, there was a desire to have a little bit more detail about what the STI clinic, what clinical nursing has been doing for STIs throughout the pandemic. We have obviously not had our actual clinic piece open, but there are a lot of things, as I mentioned, that have been going on. So I did request for our nursing team to basically just get an outline together that showed what's been being done, what's currently being done, some of the things that are kind of in process of being discussed to hopefully get started. I do have Rachel and Amber here. Rachel's our director of nursing and Amber's our assistant director of nursing. So if you happen to have any specific questions for them about the outline, they are here. We are also, just so you know, we are in conversation now with both Crossing and SIU about the possibility of getting a provider here. We also have been working for a while, throughout the pandemic, basically, with the Phoenix Center, and they have come here and provided services that we are not able to provide. And they are already in conversation with them about after the first of the year, getting some interim services offered, just so we have more that we are offering while we are getting our firmer plan that would be more comprehensive for the public to be coming in. So I'm excited that some of those entities have been even more responsive. And then, like I said, Phoenix has been involved in helping us out throughout as well, and grateful that the team has come up with some things, an outline. They also have looked at staffing, as we discussed last month. It's not just about a provider that we need here for some of those services, but also the support staff. We are short-staffed. We're having a hard time, like anyone and everyone, getting nurses to staff some of those positions. So that is an important spot in the budget. But if we need additional staff, how will that impact the budget? So that if and when we can get that launched, we have those numbers ready to bring to you if you choose to add staff to our budget to support those functions. So any questions that you have, I feel very confident that they can probably answer, but I figured you'd be happy to hear that there's a lot already happening and things that hopefully will be launching after the first of the year.
So what is the Phoenix Center and where is it located at? I've never heard of it.
I'll let Rachel talk a little bit more about that. She works very directly with them, so she'll probably be able to give a lot more detail than I can.
The Phoenix Center is located in Springfield, but we work together as a region. We work with them with our HIV grant. It's under a grant called BRIG, which is kind of our Central Illinois grant that we work with on HIV high-risk patients. So they are able to offer some free services that we don't have right now. So we've been doing HIV and hepatitis C testings during our COVID clinic as just an additional way to have people in the door. They're already here, they're doing something else. We're offering this service to them as well. They can get, it's just a finger prick when they come. They would still need the confirmatory testing. What we're working with Phoenix now for an interim plan until we can get our own STI clinic up and running is including this has been brought up here before about a brown bag service. So essentially, when they come to do this HIV and Hep C testing, they could also provide urine urine gonorrhea and chlamydia testing as well. That's not a long-term plan because that's not the best method of testing. It does not catch, particularly in women. It's not the best method of testing, but it would be an interim way for us to bring that service here while we're working through with SIU or Crossings to get a provider in here to be able to give more in-depth service to those individuals.
Any other questions anybody has about that?
Does that mean?
Yes.
they have to
so-
go, sorry, go ahead.
Yeah, the state has a program that they will have to go to. They need to be trained counselors. We're not just testing people and giving them treatment. We're also providing them the comprehensive services they need to prevent getting a future STI, get the treatment they need, teaching them about, other harm reduction services associated with whatever it is that they came in to see us for. So we need that comprehensive counselor that's required through the state to be able to have that position. They are not doing those trainings right now. We've reached out to the state to ask. We've had a lot of turnover due to COVID, as you guys know. We've lost our specialists in this area. So we've reached out to the state and said, when can we get this counseling service up and going so that we can get these people trained and competent? They're telling us they'll be looking to do that in the spring.
Seems like that would be pretty difficult to find those people.
It is a difficult position. It is difficult to find not only someone to fill this need, but also this needs to be a competent registered nurse. And as you guys know, the pandemic has, it's done a lot to nursing and to healthcare in general. And so just like the hospitals, just like, all of the other healthcare entities you see in Decatur, we are also struggling to be able to have that nursing staff support.
So they probably also command a higher salary than just an RN or a BSN?
I can't speak to the salary part of it.
So if you remember that pay grade scale that we work from, they fit into that level 8 professional level. So anyone that fits there would generally be a registered nurse, someone that's bachelor's level, or there's some positions that aren't necessarily grant funded with all of the restrictions that maybe have equivalent work experience allowed. And anybody that would be coming in, the practice historically has been they would be coming in. So anyone coming in would make that number that you would have seen on that pay grade scale for a level 8 person. And then we would get them that training here that is offered through the state and that she mentioned is not even available until the spring. But obviously it would be great if we could get someone in before that so that they have any of the other health department training, orientation, and all of that. And we have been ongoing trying to hire someone to fill that spot. We did fill it when the first person left, and that was, in the fall of 2020. We did replace it, and we've still had more turnover since then, so.
Very good. Good. Any other questions? Thank you.
Thank you both.
All right, discussion and action on septic tank sewer application permit and inspections and related costs.
This is one that Mark sent me, so I'm not sure what all he wanted to discuss into it, and I would.
So, for the rest of the board to kind of get up to speed, there was a meeting last week with the EHW committee in regards to a variety of different topics that came up in conversation. And one of the things that came up was in regards to septic tanks and stuff. So for educational purposes, I had asked this to be put on the agenda tonight to better learn and understand what the process is for the application, inspection, reports and things that are done if there's a violation found, and the timeline that's involved with all that because of contractors complaining about delays in getting inspections done in a timely manner, that type of thing. So I want to see if there was anything that the board could help staff with making some changes, whether it be a timeline of when things are done, the related cost to it. I've been told about a variety of different things brought up in the past, and with so many new board members, I thought it might be a good time to maybe get everybody up to speed on how the whole process works. So.
Want me to start?
Yes.
So, anytime any private sewage disposal system, AKA septic system, anytime a new one needs to be installed or there is a repair needed to be one, you either need to be a licensed private sewage contractor through the state of Illinois, or a homeowner can do their own property. And when I say the homeowner can do their own property, if Brian has a home that he rents out, he does not reside at that property, so he would not be allowed to do the work at that property. It would have to be a licensed contractor. So with that, they, of course, the first step typically is to get a soil report. We do have a list of soil scientists that we do hand out when people ask for them. They come out, they typically do 3 holes. We've seen sometimes 4 or 5 holes. They're 60 inches deep. They give us a description basically of what the soil is. So we know the capacity of the soil, if that soil is going to even be able to hold a septic system and maintain that septic system. After that soil scientist has been out there and they've given the report, the contractor typically looks at that report, fills out an application and brings that to us. Starting in 2011, we started approving septics only on Fridays. The reason being is, one, our ordinance does allow us 14 days to approve. But we, because of staff, we did go to just doing them on Fridays. That gives our staff the ability to get out there during the week, do a site evaluation of the site, do consultations not only with the homeowner if need be, but also the contractor. And so that when we get to that approval process, all of our ducks are in a row and it goes quicker and easier. So we started that in 2011. The fee did go up in 2016, 2015, or 2016 to $250. I think before then it was maybe 100 or 150. So again, in 2015, we raised all of the prices across the board. We haven't done it since then. It is the contractor's responsibility to call us and let us know when they're going to start the job. By code, they have to give us 48 hours notice. At that point, Brian, who is our only septic inspector, does ask, hey, when do you think that you're giving me 48 hours that you're going to start this job on, let's say, Friday, when do you think you'll be ready for an inspection? The contractor typically says, hey, afternoon at 3 o'clock, or hey, why don't you wait until Monday morning at 9 to get it all done. So we try our best to work with the contractors. We do know that weather is a big factor. Just because they call us today and say they're going to start on Friday it could be a torrential downpour, and we know they're not going to be doing the septic system at that point. So we do ask the contractors to give us a call and go, hey, you probably have other jobs scheduled when you think this is going to work. Again, that's totally up onto the contractor because it's their schedule, it's not our schedule. During COVID, when we were remote working, we did not go out on inspections. We did, however, make them send pictures of the different steps of that with the measurements. And that was simply because we were all remote working, we were going in, we were approving permits virtually, we were doing as much as we could by still maintaining that social distancing. Since then, we are out on the inspections. As soon as they let us know that it's happening, we make it work. Again, keep in mind, Brian is the only septic inspector right now. Staff is short, guys. It's not just nursing, it's my division too. We do have John that just started. I feel that he's fully trained for the most part for food, and he's able to go out and do food inspections on his own. So Brian is going to start working with him to get a backup for septic and wells. We do have Colleen doing some wells. Just to give you an idea, as of tonight, we have done 78 septic applications and permits this year alone. That's not including any of the other programs that Brian has been trying to maintain also. So the fact that we don't go out there and do an inspection, I'd like to know which particular permit that was brought up on, because Brian does a really good job of not only taking all of the pictures, He also completes the as-built, which should be a contractor responsibility, but he completes those. He also does the elevation sheet, which the contractor should be doing those, but he does those also. And we decided to switch to that so that we have a good, even playing field, because every contractor may not have the same drawing skills as Brian, so it's nice to have Brian out there with the ruler, and he does it all nice and neat, so that when we get reviewed, it makes sense to the reviewers to write PH. As far as a complaint goes, if somebody calls in a complaint to a septic system, we do go out, we do see if it's founded or unfounded. If it's founded, we know that septic systems are pricey. It's not a simple, just pump your tank for $200 and it'll be good for 6 months. So we do work with the homeowners. Most of the time we say, let's show me progress every 15 to 30 days. Show me that you've hired a contractor. Show me that you've done a soil report. Show me that you've turned in an application. As long as they keep contact with us, we continue to work with them. There have been cases that we have turned over to the state's attorney's office because they have refused to comply with us. And I can't speak to those, but we do our best to work with those homeowners when it comes to that failing septic system, because it is a very pricey fix. With current code, sometimes it's not as simple as just putting a septic tank in a lateral. Sometimes you're gonna have to get a mechanical system, and that involves an electrician and everything else coming out.
So from the time I guess I'm trying to make sure I got this timeline right. So from the time the application is submitted, you guys got 10 to 14 days to do.
So from the time the application is submitted, our ordinance allows us 14 business to approve it. However, we try to approve it the same week. The only time that doesn't happen is, let's say we do have a limit at 9 o'clock on Friday. So if a contractor brings in an application at 8:30, Brian will go out, we will still try and get it approved on that Friday as long as there's no missing information. Now, if they bring it in Friday at 2 o'clock in the afternoon, it's gonna wait till the following Friday for us to go through the approval process, and that allows Brian Monday through Thursday to do all of the additional steps to get to that approval.
Okay, so everything leading up, all that is leading up to the actual inspection itself done, right?
So once you get the approval, that now goes to the contractor, to where the contractor will have to fit it in with their schedule and the homeowner schedule. And we do not have any jurisdiction over that. The only time we get to there is when that contractor calls and says, hey, Brian, we're gonna start this job on Wednesday afternoon, and he starts the clock at that point.
Okay, so what's the timeline for that, the 24 to 48 hours, is that what you were talking
So
about?
48, the contractor has to give us 48 hours prior to digging and prior to starting that construction, that job. And then at that point, Brian works with the contractor to know, okay, is it a small system that, something that you can be done in a day? Or are you gonna have the tank set on Thursday and you're gonna do the field on Friday? He works with the contractors to know that detail.
So what's the expectation from the contractor's standpoint, once he's given you that notice and he's doing his excavating work, what's the expectation of time that you guys are gonna be on site to do the actual inspection?
That's gonna be based on when the contractor feels the job is going to be ready for that inspection. We can visit at any time, but we do like to go out at different times. So maybe when the tank's set, or maybe when they're doing the field to make sure that the elevations are gonna be shot. But there isn't a specific time frame, because again, he may be working on 4 septic systems in one day. So we cannot say, yes, Mark, we're gonna be there at 2 o'clock in the afternoon.
So until the construction phase of the project is done, you guys can't pass the inspection, they can't close the hole back up, right?
By code, that is correct. You are not to backfill anything until a full inspection. However, the majority of our contractors do backfill before we get out there.
Is that due to just safety concerns?
No, that's due to just time and sometimes by the size of the lot.
Okay.
So they backfill it 100% or they spot backfill it?
We ask that if they need to do that, that they leave the ends open for us. Yes, we want the ends open no matter what, so that we can do at least that portion of the inspection without it being covered.
Okay. One of the other things I had brought to my attention was a question about if you have on one piece of property, you have multiple tanks, my understanding is you guys charge an additional fee, an additional soil test for each one of those.
That is correct, because it's two separate systems being put in.
What's the logic behind that if you're doing soil testing?
It's two
on the
separate
property?
systems going in two separate areas. Just because the soil out your back door doesn't mean it's gonna be the same soil 30 feet down the road in your front yard.
So what's the distance on soil testing, within what proximity?
There isn't a set distance.
So if I'm building a tank over here and I want to get soil test done over there, you guys accept that?
No, your system has to go within the parameter of the soils.
The soil testing has to be done within where the tank's being put?
Yes.
Okay, that's what I was asking, to clarify that.
I'm still not grasping the 14-day piece. I know it's just me, but, so if a person wants to, apply for a new septic system, they apply before Friday?
Mhm.
And they have up to 14 days?
No, we have up to 14 days to approve it.
That's almost 3 weeks.
And because you have to make a site visit?
Correct.
And what else do you have to?
So Brian's gonna go out and do a site eval.
Yeah.
He's going to make sure that what is actually on that application is true to that site. From there, he's gonna, make sure that the contractor has filled out all of the application correct, the map is correct. We've added to our septic application, I don't know, a few years ago with having homeowner signatures, because some of our contractors were so quick just to hurry up and, let's get this turned in, that the homeowners weren't even aware of their responsibilities. So there are some questions that the homeowners call and go, hey, I know I signed this, but I don't know what I just signed. Can you explain it? So that gives us time to do all of the consultations, all of the site evaluations, and making sure that we're approving everything per code.
Sometimes additionally, after an application comes in and I review it, there may be additional questions such as if there's two plumbing outlets from the same house, because it's an older home that's had several additions, and they may have to redo some plumbing. They have not thought of elevations for the entire thing, and to either simplify or to make sure that they'll have all the additional pieces of the lift station, they may be able to move the tank to a different area to catch all the plumbing. I'll try to review all that, talk to the homeowner, and that may require more time to do some more examination. So that's the up to 14 days. Most of them are less than a week, but if we get a complication, that allows us time to do some more reviewing so that they don't put something in that then isn't the optimal.
And I think it was last spring, we had a really wet spring to where it just kept raining and we couldn't get the rain to stop. And we had a lot of potential possible failures of septic systems. So we were all out all over the place. But that was just because the systems were just filled with water. So that gives us enough time in case those situations come up that we've got a couple extra days to work on everything.
So I guess one of the reasons, just and not knowing any better, why does it take 3 weeks potentially to get an application approved if you're only doing 1.5 septic tank systems a week?
We try
Seems
not
like a
to do
big
that. We
time
try to
gap.
approve them every Friday, Mark. But according to our ordinance, we have up to 14 days. But we try our best not to take that.
But I mean, from a time standpoint, from what you're telling me, you gotta go out and look at the site, are you waiting to get the soil test results back as part of your application process prior to the inspection then, is that correct?
No, when the contractor or the homeowner turns the applications in, they have to turn in a soil report at that time.
So that has to already be done.
Correct.
Okay, are there any other questions?
Yeah, I just wondered, that seems like a lengthy time. What would you say, so you're saying that you are getting them done, would you say on average you're getting them done on a weekly basis then?
Yes, we try our best to get them done every Friday if they're turned in that week. If not, the contractors are being called to explain that this is why they weren't approved, or this is why we didn't get to it. There have been some situations where one of us has been off on a Friday, so we try and either do it the Thursday before we're off, or that Monday when we're back in.
So it's either Brian or you, Kathy, that deals with the septic tanks and possibly this new person.
Yeah, so Brian's over the septic program. Years ago when I started, it was based on where the home was located as to what inspector you got. And that was never a good thing for our contractors because, one inspector may say, no, I read it, it's supposed to be 9 feet. No, this is a EQ 36, so it's 6 feet. So one of the things I did is I put, Brian, you're in charge. So when he goes out, he's telling the contractors the exact same thing every single job. And that's my goal for John too, is to get him trained on that too.
So by having the second person, that's gonna help you guys a lot.
Immensely.
Do you need a fourth person, or do you think that's adequate?
I will say that my division is down one person and has been down one person since pre-COVID. And we're making it work the best that we can.
So it looks like, I want to grab this real quick to look at, because that's one of the questions I had is this somewhat cyclical, but it looks like you've got quite a few. I mean, it seems like there's not like a really slow month and a really busy month. It looks like it's pretty consistent then.
Correct.
Is that correct?
Correct. Now, years ago when I started, normally you didn't have any septics going in like December through March, and that was because we had colder weather and the ground was frozen. Now they pretty much can put them in year round.
So you said you guys only did 78?
We have right now, as of tonight, we've had 78 applications turned in. That report is as of November 30th. But keep in mind, we do more than one inspection per site also.
Okay, so that being said, then can you enlighten me on the fact that I'm looking at your report for this month? I want to pull this back up. So inspection activities with sewage and septic, you guys got a total of 314 for the year. So if you're only doing 78, where's the other 200 and some coming
That's
from?
all of the consultations, that's all of the site evaluations, that's every inspection, that's everything regarding a septic system.
So it's actually a lot more, well, it's 78 permits, but there's a lot more overall time put into it. That's what I'm looking at, because your numbers are pretty, numbers are pretty consistent across the board, except for the springtime, which I could understand that being down a little bit. So you're actually doing a lot more than just an inspection. So you're doing almost you're doing 5 activities for every permit you issue, almost. Is that a fair assumption?
But that's also,
Brian?
we also have complaints that go into that, septic complaints are separate. So yeah, there's a lot of work. It's not just going out and approving an application and doing one inspection.
Okay.
Which I think that can be a safe assumption for all of our programs.
Okay. That's all I have on that.
Okay. Discussion of sub-department obligations and legal responsibilities for taking action on citizen complaints and hazardous health conditions. That was what was said.
So again, this came out of the conversation from a meeting last week. And Mike Baggett was there, and I'm assuming that's why Ms. Reeder's here tonight to respond to this. So there was an issue that was brought to the committee at the time, and I attended that meeting out of invitation to be there to hear what was going on. So my concern for the rest of the board to understand, there was an issue that was brought up by a business owner, citizen, that he was dealing with a specific issue that kind of brought us to light about what in his mind and some other people's minds was a hazardous health condition at a business that has a food license and related businesses surrounding this facility in particular. We can get as little or deep into the graphics of this, but I can tell you, I was pretty appalled by what I heard. At the end of the day, the police have been to this location numerous times over the last 30 to 45 days. There have been complaints filed by business owners and other citizens to the police department regarding this issue of this hazardous health condition being present. And what I took away from the meeting when it was all said and done, Mr. Baggett was of the opinion that the health department had the ability under the statute to serve some kind of a letter or notice to this business that to basically put them on notice regardless of who's responsible for causing this health condition, hazardous health condition to exist, that the health department has the authority to write a letter to basically put them on notice, and then that could be followed up with some further action. So I know kind of what came out of the conversation, the way I understood it, and Brandy can add to it too, was we have that ability. Mike mentioned a couple different times over the course of the conversation that the health department has the authority to write such a letter to the business owner and basically kind of put them on notice that, hey, you got a problem here, you need to clean it up. And then if he chooses to ignore that, then that provides two things in my mind. It gives the health department a little bit more leverage to move forward with a little bit more aggressive action towards something that might impact the licensing, but also it helps out the police department when they get the opportunity to prosecute the individual or arrest this individual for their very vile activity that they've been conducting on this property. But at the end of the day, I think we owe it to ourselves as a board and to the citizens of Macon County to make sure that we're being very proactive about things that constitute a safety and a health hazard to the public. And that's kind of what came out of this conversation as to whether or not how much authority the health department had. And I think what staff may be looking for is some guidance from the board to put something in place to give them a little bit more of assurance and ability to take action when a situation like this arises. Because I can tell you the details of this thing, and I've worked in a lot of really nasty places. This totally grossed me out. And I really felt pretty strongly that the health department should have been already taking some really aggressive action on this and had chose for whatever reasons not to. And I think that we need to hear a little bit more from the staff administration on this issue and try to give them some kind of guidance, make a recommendation for them to follow through, not only on this specific case, but on future cases, that we have something put in place to give them the tools necessary to take whatever action is needed, even though Mr. Baggett had indicated that presently the statute gives them the freedom and the flexibility to do so. I think that they were a little uncomfortable of proceeding with this action without a little bit more guidance. So that's why I wanted to bring this up to the board.
Brady, may I add a couple things to quick before you speak? Sure. The one thing that I do want everybody on the board to know is that Illinois Department of Public Health was contacted regarding the situation. We did have a conference call with Illinois Department of Public Health last week regarding this. And it was stated that this was not a public health threat, that it was more of a retaliation and vandalism that needed to be handled because it is just one individual. It's not multiple individuals. The other thing that I did mention last week, and I want to bring up now, is neighborhood standards. I did pull their regulations. That's with the city of Decatur. They do follow the 2006 International Property Maintenance Code, which does talk about all exterior property and premises shall be maintained in a clean condition. The owner or occupant shall keep the exterior property in a clean and sanitary condition. That was where both Brian and I directed the individual who made both complaints to go to, because they have the jurisdiction in this one, not the health department.
Okay, so I'll just give you a brief summary of, I guess, what's happened and, you know, how we got to here. So
let me make one short comment. I think everybody needs to know the details, and
Oh,
and
yeah.
you were a gentleman, and
I was
very
going to allude to,
polite,
when we got
and maybe
to that
it
point,
would come out better from a woman.
Oh, I'm happy to tell
But
exactly what's
it's
going on. I'm
pretty
happy to show the
disturbing.
picture.
it's disgusting.
Would you like me to get the picture?
If you want to, sure, when we get to that part. So, the first, well, I don't want to say the first, but the first that I became aware of this particular situation was December 3rd, and that was Kathy getting me updated about what had been going on. So, what I was informed about at that time, and when I get finished, correct me if I give anything incorrect here, but is that, Cody Parks was requesting a letter be provided by Kathy that stated there was no health hazard or violation or something of that language at this facility. So my understanding at that point was that Cody was the landlord of this property. And in this property, there was someone who is a tenant that is a permit holder that has a food permit, okay? That place has had some complaints that have come into us. There was a complaint, I know earlier, so you'll have to speak to that, but the one of the most recent was November 18th. We did go out on that complaint. We have 10 days to go out on a complaint. Brian went within 2 hours of receiving that complaint. Another complaint came in, I believe it was November 23rd. Brian and another employee also went out on that complaint. So just so you know, we did take action, we did go. There was inspection reports done that are online for anyone to be able to see. We did take action on what we could. We did make recommendations for where Cody could go, such as neighborhood standards. We also, not we, but the staff was proactive and submitted some information to the Illinois Department of Financial and Professional Regulation, because one of the issues was there was potential or alleged haircutting going on in this facility. So that was checked on in the inspection, but also sent on to IDFPR. So when I became aware of the situation on December 3rd, it was because Cody had texted Kathy with a picture of poop. Some have said human, some have said dog. I don't think it matters, but just so you know for the record, and it was smeared on, the picture shows poop smeared on the window of the establishment. He wanted Kathy at that time to write a letter that stated there was no health hazard happening there. Kathy told him, and I supported this at that time, and I still do, that we don't do letters like that. We can't make a blanket statement that there's no health hazard going on at a certain place. We followed up on the complaints. We did inspection reports to show what we did or didn't see based on the complaint. But that doing a letter such as that was basically a special request for something that's outside of the scope of what we normally do. That was a Friday. So I supported that morning. Later that afternoon, I received an employee complaint that Cody had called in and was yelling at our clerical staff in environmental health. So that's when I said, okay, I'm going to call him. I'll call him this afternoon. Kathy called in with me so that it was both of us. And I had what I thought, was a productive conversation with Cody and just said, this is the reason that we don't give the letter. It's outside of our normal scope. It's not something we feel comfortable doing or that we normally do. We'll follow up on complaints. I did ask Cody. Cody was upset, and I was told by my staff person that he was yelling, and there was witnesses, that he was yelling at her and very upset that Kathy was out for the afternoon. He was threatening to go to the news about it, etc. So I just asked him, please, in the future, if you have something that you need or an issue with staff, like bring that straight to me. I'm happy to help. If my staff isn't cutting it, if I'm not cutting it, I want to address that. But yelling at staff or threats, especially on behalf of the board member, I thought was inappropriate. So I asked him to please not do that. And I also asked him in the future to please submit complaints through environmental, call that main line so the clerical or whomever is covering the call desk can take that and go through the proper channels. Because one of the things he was very upset about was that Kathy got his text in the morning and did not give him a letter by the end of the day. And I said, my staff are allowed to take time off. They have appointments, they're sick, et cetera, et cetera. So they may not respond to you immediately on their personal cell phone. And I'm okay with that, which is why we have set, coverage systems set up in the building. So I asked him at that time in the future, if you have a complaint, if you could just get that in through that process so that we do have the documentation, we do have someone covering that's available, in that moment, et cetera. So talked to him that day, and I did tell him, I said, we're going to debrief about this on Monday. We're going to discuss. I want to look at reports, look at things, talk through it in more detail with Kathy. I will also, if it permits, I will also speak to Mike Baggett with the state's attorney's office. If he says, you know, do a letter, et cetera, like, I'll get back to you on that, but basically at this time, I don't feel like that's appropriate. And so on Monday, I got a phone call from Ed Flynn, which is the attorney that represents us for human resources matters. We as the health department are only allowed to use the state's attorney's office, or if they give us permission to use someone else. So for food code things, ordinances, all of that, we use Mike Baggett from the state's attorney's office. For human resources matters, we use Ed Flynn. So Ed Flynn called me and he basically said he used to represent Cody. Cody came in, he can't believe some of the things that he heard, and that we need to just get him a letter within 2 hours so the police can go arrest this guy. And I told Ed, I said, I'm not comfortable doing that, but I'm going to call Mike Baggett. I will ask him, you know, basically get his guidance on this, you know, legal guidance on how I should proceed or what is appropriate this time. And at that time, he said, you can go ahead and do that, but if you're staff and you think there's no health violation, you're not doing a good enough job at inspecting. And I said, okay. And he asked for me to get back to him. I told him I would get back to him. At that time, I did try to call Cody, and then I also did try to call Mike Baggett. In the interim, I didn't hear anything back, so I called Ed again just to let him know what I was doing. I was in conversation that day with Brian Wood, who had been out to the facility, and also with Kathy Wade, and just basically kind of talked through, here's what our plan is going to be. I asked them to go out that day, that afternoon. Brian went along with another inspector so that we did have, you know, 2 staff, 2 witnesses basically for what was going on there, because I did feel like, okay, we got this information. Ed now has said he's gotten information from Cody, and I feel like, you know, this permit's going out. We did have the second complaint that we still were going out on anyway, so I asked them to go that afternoon. They went that afternoon, inspection reports online. When I did talk to Ed that second time, he did basically say he was gonna take himself out of it because he did feel like since he represents Cody and us, that could be a conflict. So he said, just proceed as you are and, you know, basically step out of it. When I talked to him, I also said, if you could have Cody call me back, I do need more information from him so that we can move this forward and follow up. So Cody did call me. We had a conversation. During that conversation, and this was the first that I've heard of this, there's been no, you know, prior complaints with it. Cody did say he feels as if he's being targeted by Kathy or the division. And I asked him how, you know, that was, and he gave me a couple of other examples, which include a situation that happened at House of Meats some time ago, and also a septic situation that occurred some time ago. So we talked through those things. I told him I was gonna look into that stuff, which I have been, and I got information pretty much immediately after from the staff. I also spoke with Mike Baggett. He did get back with me and basically said that the letter, that Ed should not have been involved in that or requesting that letter, and that it is outside the scope of what we normally do, and advised me not to do the letter. That was before, he wasn't even aware that Cody was a board member. One of my concerns too is I feel like this was a special letter, plus I felt like a special letter being requested by a board member, which is something we don't normally do, was definitely something I was not going to do without legal guidance and have the possible perception of any kind of favoritism, inequitable treatment, which are things that particularly this division has been accused of in the past. So it's especially important, I feel like, to ensure we aren't doing that just across the board, not just with anyone or in this one situation. So Mike did tell me, you know, that is not, that he would advise not to do it at that time. So fast forward to, Tuesday, I think of last week, Linda Little with EEHW sent me an email, and she asked that Kathy and I be present at the Thursday night EEHW meeting, which I usually go every month, but specifically to talk about this situation. We went, of course, the 3 of us all went so that we could speak to, you know, whatever would come up. Cody said his piece, I said my piece. Other things came up, the House of Meats and the septic situation, which I know were things, Mark, that you wanted to discuss tonight as well. The EEHW meeting, basically EEHW said that they aren't like giving a directive on this, but that they would like the Board of Health to basically decide what the health department can or should do moving forward. Mike in the meeting Thursday night did say he gave the guidance not to give the letter, and he would give that to any entity, not just the health department. And then he did later say that stating something as a hazard is something that we could do, which is what Mark was speaking to, I believe.
That
And
you
so-
do have the ability to write the letter, like, yeah, okay.
Right, and I
Just
think,
so everybody's clear on that.
Yes.
The health department has the ability to write the letter, unlike the other two statements that maybe Mike had led you into that you didn't in the beginning.
well, I think it's slightly two different things, because the letter I was originally, Kathy and I were originally asked to provide was a letter stating there was no health hazard, there was no health violation there. And what evolved, I feel like, in EEHW was a request on behalf of EEHW for us to be able to say, or for the board to direct me to be able to write something that does say, this is a health hazard, or clean it up, or do what you need to do, you're making a mess, you're causing problems. I did ask an EEHW, so I could bring back to you for very specific clarification of, what does that mean? Because I thought Mark made a really good example during that meeting in saying, okay, if someone broke the glass of the place and there's glass laying on the floor, that can obviously be a hazard, but that's definitely not in our jurisdiction. The poop on the window did not present an issue, a food code violation, which is why at that point, jurisdiction-wise, there was nothing more that we could do. And so I think one of the things moving forward, I'm gonna need from the board is, if we're going to do things like these, I guess, what are the parameters? I know we've talked so much about, like, the food truck, for example. If it's 200 feet, we gotta know it's 200 feet because people are gonna question it. So if it's a hazard, I gotta know what's a hazard, what's not a hazard. Where do we step? Where do we not step? This poop was it was outside on a window, the picture that we received, away from the door. It wasn't inside. It wasn't being, there was no evidence of it tracked into the place. So I guess I need parameters, because otherwise, again, we're not gonna be able to consistently implement this process if this is something that the board wants us to do. And I just wanna be sure that if we're doing it fairly, consistently, appropriately, as we move forward. So if anybody has questions for me, or if I missed anything major, I'm happy to answer those. I hope that I did also ask any EHW, and I'll ask all of you as board members, if you do ever have problems with my staff, please bring that to me. With this situation, this stuff was never proactively brought to me as a concern. I reached out and obtained the information, and I can't correct things, or I can't deal with things, or even correct things in myself if I'm not aware of them. I did feel as if the EHW meeting, which there's not minutes that I've seen yet for me to share to you to have like the verbatim recording of what happened, but I did feel like that was unfortunately an inappropriate outlet that was used. I did feel like there was some, I felt like Cody kind of bashed my staff in this open platform for a significant amount of time. And I just felt like, especially with it being a board member, I wish that it would have been handled differently. So I did say that EHW, which is why I'm saying it to all of you. I'm not trying to make you uncomfortable or anything, but I just ask that of all of you, because just like you as managers, or, whatever you do in your business, you can't correct something if you don't know about it, and you don't want your staff being put, on blast in that way. And I know there's freedom of speech, et cetera, but give us the opportunity, or give me the opportunity to work with my staff to address these things.
Well, I think, and I know Cody can't participate in this conversation right now, and I'm not speaking on his behalf, I'm speaking on what I observed during the course of the meeting. And like I said, as I brought it again about the glass thing being an issue, I think there was problems here prior to this happening that have never been resolved, and the other two cases that were brought up, and I asked in my email to have documents provided to me for us to have here tonight for discussion. And if it means I've got to get a FOIA request, I'm more than happy to go through that process as well to get that done. But I was really dumbfounded that two other separate incidences had happened, and the course of action was taken in those two cases. I didn't get it. For this particular case, I mean, we're talking about, you need to understand, we're talking about stuff, this had been going on for quite some time. The police have been out there on 16 different occasions. This wouldn't just happen one time and that was it. The police have got a very detailed report on going out there on numerous occasions and trying to deal with this. They have this guy on video. They know who he is. They are trying to track him down. It was somewhat apparent to me that if the police had some type of a support from the health department, it would aid them in their pursuit of this person, and i.e. would help out the state's attorney's office in prosecuting this case. Mike said that the health department had the ability to write such a letter. And in my mind, what I took away from it was, it doesn't matter who caused the problem. At the end of the day, it's the business owner's responsibility. And I alluded to the fact in the meeting conversation, again, saying this isn't a health department issue, in my mind, it can't be any more clear than the fact it's a health department issue. If you're running a restaurant or any kind of food establishment and you got a license from this department, part of the scope of your overall operation is to maintain a clean, sanitary, and safe environment. That is not confined to the four walls of the business. If I've got sewage running out my parking lot, if I've got a garbage dumpster running over, I've got rodents running around, whatever the case may be, broken glass in a parking lot, these are all safety and potentially health hazards that need to be addressed. And you're required to make sure that you're doing your due diligence to take care of these things. My thought was, number one, we as a board need to give staff some guidance to be able to have the ability to put somebody on notice and not going after their license necessarily closing them down. We're going to put them on notice, is kind of the way Mike alluded to in the conversation was, we're going to put them on notice. Doesn't matter who's responsible. I got no tolerance for somebody leaving crap on a building. And we're talking contact surgeons. I went and talked to the people over at Freckles, just out of curiosity myself, to see at what level of anxiety this is creating. They're very, very upset about the fact that this has been going on, and they feel like nothing's been getting done about it. He, as a business owner, has an obligation owning the property, but the person that's holding the license, and it's their business, regardless of what the situation is being caused by, whether it's through their negligence or their actions or whatever, they're still responsible for caretaking of that facility and making sure it's clean and safe. And anybody, I don't care if it's this situation or another situation that presents itself down the road, we should have the ability for the health department to send a letter to that individual and put them on notice saying, look, we've had several complaints. We've been out here. We feel that there's a potential health hazard here. We're putting you on notice and making you aware of the fact that we're aware of the fact, and we're making you aware of the fact you need to take appropriate measures to ensure a clean and safe establishment for your people. It's a liability from a health standpoint, from insurance standpoint, and everything else. Having done that, because now this individual is not going to tell anybody potentially that they are continuing to have this problem because they don't want to draw more attention to themselves. Now the health department has the tools to take this to the next level. If this comes up again, they can go back out there and the citizens call the police department and say, man, I went to this place and my kid stepped in a pile of crap, or grabbed the door handle and got this on their hands. That's a health thing. I mean, come on. If the sewer was running out in the yard, we'd be out there in a heartbeat, probably writing somebody up for that. This is something where persons are actually interacting. I mean, we're worried about keeping things clean and sanitized, and we're saying it's not a health issue because it's on the outside of the building. That literally, pardon the pun, is a load of crap to me. Send a letter, put them on notice, tell them if you don't take action to clean this up within a timely manner, or if we have to follow up on this matter again, we may institute further action, which may include, suspension or whatever of your food permit until such measures have been put in place to ensure that this is being addressed. I'm totally flexible on how it gets worded, but at the end of the day, I think we need to make sure that they have a clear message of support from the board that will allow them to take this, a step further without having to go through what happened last week. And I agree, it should have probably went that way. But I think, in all fairness, because other situations haven't been appropriately handled in this particular situation with individuals, this boiled out of frustration, I think, more than anything else. Because I can tell you, I was very, very upset when I walked out of the meeting the other night. I was just astounded at the stuff that I was hearing, and the attitude was that this is not a health department problem. And it really, I went home and it really, I sat and thought more, about it, the more it bothered me, because I thought of all the things that we should be doing to protect the community, and something like this gets brought up, not only by the property owner, but by the police department and people in the community that have filed complaints about this with the police, and we take the attitude that this isn't our mess to clean up. That doesn't sit very well with me, and I think it really is a bad perception of what this department's supposed to be doing. So that's pretty much all I got to say about it.
Well, and to speak to the not our problem, I don't think any of us ever said that. And we definitely did what we could do.
That's exactly what was
but-
said. I'm sorry. That's
No.
exactly what it said. This is on the outside of the building. It had nothing to do with the health department.
We
That's
were talking
exactly
about
what was said at the meeting the other night. You guys stated that very, very bluntly.
We said it was not, what was found during inspection was not in our jurisdiction, is what was stated. We didn't say it wasn't our problem. We have, like I said, made referrals. We've talked to the state about this. I mean, the amount of time that's gone into this has been significant. But when those inspections were done, it was determined it wasn't in the jurisdiction, that there was something in the food code that could be determined as a violation. So that's the message that was coming. And to clarify, the police have not asked us for anything. They've written us a letter, a long letter. I did make myself and Kathy available if they wanted to talk and haven't heard about setting up a meeting. We've referred Cody to other places that it is in their jurisdiction, whether it's IDF, neighborhood standards, et cetera. So that is not what we said to any stretch of the imagination. And as far as FOIA, we have received the FOIA request and then your request. That was not ignored. I needed to follow up with you because what is being requested, and I know that you submitted a FOIA request as well with this stuff. And so the message to both is that that's very, very extensive record. So I was going to have private conversations with you about, is there a way to narrow down like specifically what you're wanting? I know you have the inspection reports, but what else is needed? Because otherwise, I mean, that is a very unduly burdensome request for it to be every single record ever talking about these things for all staff. So is it, certain staff that you want? Is it a certain time period? Stuff like that. That would help me be able to get it to you more quickly and narrow it down, because everything from everybody from the whole building that probably wouldn't even touch to run reports like that takes a lot of staff time. So yes, of course, we'll get it, done, but I was going to ask you just to narrow that so I knew specifically what you would want. And as far as the other two things, being the septic system and the house of meats, I know you want to look at records, so you'll have the opportunity to do that for sure. But also, I hope the assumption walking out from the other night was that it was all done wrong, because you haven't even seen what was done. You've just heard one side of the story. I didn't even have the chance in EEHW, nor did my staff, to defend what was done in House of Meats or that septic system. So it's very much a one-sided, you did it all wrong, the staff is targeting me, and then let's leave the meeting without me or my staff having the chance to defend any of that. So hopefully once the board reviews that set of records, you can see that it was handled appropriately. And just because a business may not like how something's handled doesn't mean it's not handled according to the proper processes. So I'm not saying I'm against sending letters that say something's a hazard. I'm not saying that at all. I was against sending a letter making a blanket statement that there was no hazard there. I was being asked for Kathy to put something in her name. Kathy Wade, said there's no health violation at this place. That was a different thing than what we're talking about tonight. I don't have a problem doing that, but I do request from the board support and parameters as far as when do we send it and when do we not? Because we also have a situation that I needed to discuss in this section. We have the wit's end situation with the stipulations. They're not meeting the stipulations now. So I did talk to Mike Baggett about that today. What's the next step? And he asked me to ask all of you, what do you want me to do? You gave us the discretion to put stipulations. Those were put in a responsible way, and they're not meeting them now. So what's done now?
Really not meeting, because I've been there 2 or 3 times, and I think the place looks immaculate, and I think they're doing a great job.
I'll let Kathy speak because she's got that. I know you just sent me that earlier today, so I don't know if you have it memorized or not.
One of the issues was that they were supposed to have a.
May I suggest something as council?
Sure, yes, please.
Let's finish one issue before going on to the
Right. I was just getting ready to say that.
Just a suggestion.
Thank you. Yeah, I was just getting ready to say that as well, so that's, yeah.
So anyway, it's up to the board. I do not have a choice. It's to the board to decide if you want us to do these, but I do request something like a parameter of when do we and when do we not, because you're gonna have a restaurant that has, you know, let's say a bunch of mice outside, and that may not constitute a food code violation, but if people are complaining enough, maybe it's a hazard. So then do we send a letter? Do we not? But then there's gonna be business owners who are mad. Why is the health department bothering me about mice outside when I can't control that? So I think that we need parameters, because I think that this can cause a lot of mess if we don't do it, you know, in the right way. And that's up to all of you. So I would just request that from you, if that's something the board.
My biggest thing is anything that's on contact surfaces within, you know,
Find a contact surface, please.
well, door handles and windows and
And you want
Walk in
you
front of
want
the
all
doors.
non-food contact surfaces or just food contact surfaces?
I think those are all contact surfaces. You step in it, you carry it to the store, you put your hand on the door handle. If it's on the door handle, you're tracking that in. Now you have that.
So when Walmart has all of the pigeons in the parking lot and you're going to Walmart to do your grocery shopping and you step in pigeon feces, would that constitute a hazard letter to Walmart from the health
If you
department?
rub it on door handles, I suppose it would. But hopefully people aren't eating off the bottom of their shoes. If that's the case, I mean, this thing will go all over the place. Bottom line is, I mean, we need to do something, and not doing anything is not an answer.
I still feel like you all know the full story and I only know part of the story.
Right.
I mean, was it vandalism? I don't.
It was retaliation and vandalism. It was
So why
facing
isn't it more of a
All right,
police
if
issue
I
than
may.
a health department issue? I think it's a police issue, first of all.
I'm sorry for what happened, but it's not like.
Why can't the police help?
Scott has something to say, so.
If I may, talk with Mike about this and back there. All right. I'll try and be brief, but complete. Bits of this have been alluded to. Essentially, as I understand it, Mr. Park owns a building. That building is rented by a tenant who has like a convenience store, food issues, has a food license. He is also someone who apparently has decided that it would be humorous or entertaining to offer haircuts in his business to people with mental disabilities. And again, if anyone thinks I'm getting something wrong, let me know. But this is what's been described to me. And as such, he will encourage people in with mental illness, mental disabilities, give them an intentionally bad haircut, and then post such on the internet for the entertainment of whatever sick mind thinks that's enjoyable. So that's the haircut issue. But apparently, the way this devolves into relating to this story is that one of the individuals who was the subject of said haircut has decided to retaliate to the business owner by spreading some form of fecal matter on his door handles and windows. There's been, whether it's human or dog, that's up for debate. Better scientific minds, I guess, no. So as a result, then, there's been confrontation, I believe, between Mr. Park and his tenant about whose responsibility it is to clean it up. As a result of that, there has been, to get the tenant to take responsibility for it, I believe Mr. Park has contacted the Board of Health to do an investigation. Is there some type of action they could take? In the meantime, the police have been contacted. They are aware through video surveillance exactly who the individual is. We've just not been able to locate him to make an arrest and resolve the situation that way, is what I understand the current status is. I mean, they won't find him, doesn't mean they're not looking, just means he's not been available for them to make the arrest. But the issue still exists. There is matter that needs to be cleaned up. So is that accurate as far as everyone knows?
I would say so.
Okay, all right.
To take that, oh, sorry.
Yeah.
Yeah, the first complaint that called in when Brian went out there, the fecal matter was on the sign above, like on the roof that says, you know, this is the name of the store. The fecal matter had been thrown up there. There was none seen on the sidewalk, the windows, the door handles, none inside the facility. The second complaint that came in, it's 2 windows. It literally looks like a circle on each window. Again, none on the sidewalk, none on the door handles, none inside the facility. So those were the items, or I shouldn't say the items, that was what was found during our investigation of both of the complaints that were made to us.
So, the next, well, and let me just say as an outside observer, regardless of what people are upset about or not upset about in terms of action or inaction, we should all be adults and behave appropriately with everyone trying to be professional. Having said that, the other issue is, and Mr. Park, I'm not trying to single you out, but I don't know what your, and this is where we get to this problem where I alluded to earlier of, it's somewhat unfair not to give Mr. Park some ability to speak in this situation, given the nature of the accusations and so forth, but nonetheless, I don't know what the nature of your landlord-tenant relationship is with him. Is it one where your rental agreement puts a duty on him to provide for the cleanliness of the building? So there may be an enforcement mechanism if there is there, and I don't know, you'd have to talk to your attorney about that. And there may be an enforcement mechanism there you can pursue. The other thing is, I do believe that it was injudicious of Mr. Flynn to inject himself in this particular situation, given the differing people that he represents, essentially both sides in this in different matters. And he's realized that, I believe, by his last statements to Ms. Binkley. So that seems to be cleared up. The next issue with respect to writing a letter, it really comes down to then whether or not the board, an important thing here is that we treat everyone with the same way and the same parameters that we would treat anyone. The important part is the quality of enforcement of the law. That is a big thing here, because you start doing one treatment to one person and one to another, as you all know from common sense at this point, we're going to get our butts sued. We don't want that. All right, so the question becomes, what is the equal treatment? What is it that the board, what is it the Department of Public Health has the ability to do? And Brandy, I have to ask you, do you ever write a letter saying we find no violation?
We do an inspection report.
Okay.
So if they do an inspection and there's no violations, then the inspection report would reflect that, and those are posted online.
Right, and that is the inspection report you did with respect to this, was that the result?
Yes.
There's no violation in your estimation, okay. So those, but to write a specific letter, and I don't really understand what that letter would have done, and I'm missing something there, but that just seems if it's out of line, it's something we don't normally do, we shouldn't do it. Now, that does not affect, and I think Brandy is right in the way she characterizes this, that's a separate item from writing a letter saying there is an infraction, okay? And then when Mike says, Mr. Baggett says, you can write a letter saying there is an infraction, that's the same thing you do every day on other businesses, all right? So there's no dichotomy there that's inappropriate. The question really becomes, the department is looking for what are the parameters here that make this different from ordinary situations, that make this a situation where they need to write a letter. Now, you have to decide either to trust your staff in the department to do their job the same way and with equality that they do it with any other place. And so you have to look at what are the issues, and what they're seeking, I think, clearance for is what the issues are that make this a different situation, since in their evaluation at this point, the fecal matter is not near the food service and those sorts of things. That's something for you all to work out, okay? But the guidelines need to be the same for everyone. And so the guidelines, if they're going to be guidelines, need to be precise so that we, again, don't go back to getting our butts sued because of difference of importance. Again, not particularly helpful in terms of what you should end up doing, but I hope instructive on where we're at and how this all came to be. Now, having said my bit, does anybody have anything that is in contrary to the advice or what I've said here? Anything that is objectionable then.
I guess my question, Scott, is, and that's what I was trying to get to the other night, and I'm still trying to get my arms around tonight, is what, okay, so an inspection report was done when they went out there. I understood you correctly, so they did one inspection report or two?
There are two.
Okay, so because this stuff was on the outside of the building, in an inspector's mind, because of where it was at, it doesn't constitute a health hazard in any way, shape, or form.
Do you want to speak to that? How you did the other night? I mean, yeah, I think that you described it really well the other night.
Because I'm curious, and follow up with this, then way our health code is presently written in regards to food establishments, where do you guys draw the line on what you regulate and inspect and oversee and what you don't? And that's what I was getting back to the other night talking about, there's obviously, garbage strung out on a parking lot, or they dump grease on the ground or whatever. I guess if you went out and found those kind of violations, would you reflect that in your inspection report, either as an actionable item that needs to be corrected, or do you just ignore that stuff because it's on the outside of the building? Because I'm trying to figure out, have I got two apples or have I got an apple and orange?
In response to what I observed when I got there, there wasn't a specific violation of the food code that I could cite. So it would have been inefficient and a non-enforceable action that I could take, basically. So that's why I referred, since it was exterior of the building and it wasn't generated by the establishment, since it was generated by another source, that's why it was really a property maintenance issue, which the city of Decatur's neighborhood standards would be able to expediently issue a citation to the building operator to do something about. Me using the food code would have been a stretch, that would have been inefficient. The best we could have done would be write a letter, give them a period of time, which we have a kind of a risk-based thing of 5 days, 7 days, 30 days to follow up. So it would have been at least 5 days before I would have followed up technically and said, is it clean yet? Well, that's too long of a period for it to sit there when there was a much more efficient and expedient way for it to be enforced by another agency. So that's why my referral was to say, call neighborhood standards because they can do something. And my address with the store operator when I was there, I couldn't cite the food code, but I did say, it's your establishment, you're the one in charge of maintaining it. So yes, you should clean it up. I can't give you a fine or a follow-up in that it's not a violation of food code. So I just advised them verbally and they agreed, yes, it's our place, we need to clean it up. Now, whether they did or not, I didn't have any teeth to force them to, whereas neighborhood standards or the police would have. So that's the action.
Yeah, okay, so don't think that's about enforcement, but you said you had the ability to write a risk inspection letter and provide that to them.
Well, and I did that in the form of it's not really a report, it's a narrative of my observations and my interaction with the store operator. So a report would have been based on a checklist of the food code that I would have cited something specific. Since that wasn't really applicable, I just gave an observation and a narrative of my conversation with the operator and what I had seen and the action they needed to take to alleviate the situation. I can't really say a corrective action, but to address the situation, I gave them advice on how they should do that.
So was the business owner given a letter to that effect?
The letter is, he's referring to an inspection report.
Yeah, so he was given a
Not
copy of
letter, it's
that
inspection
at that
report.
point.
So that information was on the inspection report then?
Yes.
And that's the one that's online. There's two online, but.
So I guess the question is, Scott, do we try to create something here, or we just allow the freedom of flexibility because the statute allows them to have the ability to send some kind of a letter, kind of putting them on notice, but not really citing any violations? Is that a, put us in a legal?
Well, I would suggest,
or is that, I mean, there's nothing wrong with writing a letter to somebody and saying, hey, you've got something there, I'd highly suggest take due diligence and clean it up. You're not putting them in any kind of a bind financially with a fine or, shutting them down, I don't know. And again, I get what you're saying. If you see mice running across the parking lot, you have to run out there for everything that comes up. I mean, there's gotta be a little common sense with this thing. And in my mind, if you'd say, hey, I can tell you right now, I'm dealing with it downtown, working on the theater. I got people that are doing unspeakable stuff right on the sidewalk and in places in plain view, right on a public sidewalk that people are going up and down every day. I have no control over it. I've made some adjustments to try to help address the issue. I don't have anybody specifically to go after. It's a public nuisance, but is it a health hazard? Yeah, in my mind, some of the things they've done definitely create a health hazard, but I don't have nobody to send a letter to. So I guess.
Yeah, there's no problem with the department, I think, writing a letter, even strongly worded, saying, hey, look, buddy, we think just a general policy, you should clean this up or it could affect your business, and please do so. I mean, there's nothing wrong with that. Of course, the problem comes what if he pushes back and says no, but I don't know this person, I don't know if they're going to. That's more of a follow-up than that, and maybe that solves the situation and we're all churning butter for no reason. And I just made that phrase up, I don't know. But the other thing is that if you try and come up tonight with a uniform policy, that's going to take a while to get something fleshed out. My suggestion, if you want to pursue that route, is perhaps form a committee of individuals out of the board to come up with and staff can just say the board, it'd be good to have staff anyway, to come up with a proposal for such a legislation, I guess, or a way of dealing with these situations. So if you're getting in trouble, just nobody can do anything on the spur of the moment like that. You're getting in trouble doing something on the spur of the moment. So my suggestion is you take measured time and do it intelligently rather than just try and whoop it up at the minute. But again, I'm here as legal advisor. It is the board's prerogative. You are the masters of the ship. If you decide you want to sit here and do that tonight, have at. But my advice, and it is simply that advice, is make a committee perhaps if you want to look at the issue, to decide what structure you want to have to such a policy within the department.
Well, my concern, that's why I wanted to bring it up tonight, was to get the conversation started. I agree, this is not something you're gonna discuss tonight and come up with a remedy, but the big thing is I want the public to know that we are looking at things like this as they do come up. We do take them seriously. We are taking appropriate steps to look into it, discuss it, formulate whatever policies we may need to make or amend, whatever we might need to do, because if there's been that many people that have contacted the police department, this isn't just one person that decides to keep calling 911 and calling about their neighbor screaming cat next door. This is coming from multiple people making a complaint about the same individual business. Then I tend to lean towards the credibility of the public. And like I said, the police have much bigger and better things to be doing with their time than dealing with something like this. And I think we all need to work together. As I alluded to in the meeting, if the glass gets broken out the front door and I walk up there and try to walk in the building, I step in glass and cut my foot or slit my wrist because I stuck it through the plate glass window that was broken and hadn't been boarded up. Is that really a health issue? No, common sense says it's a safety issue that potentially could lead to other things. And I think it's just part of serving the public that we take, a step of measure to at least put the person on notice and say, hey, there's been a lot of complaints about this. We suggest you take some appropriate action to maintain a clean and safe environment regardless of who caused the problem. That to me is irrelevant.
Well, the guy cutting the hair, wouldn't that be a violation?
Yeah, guy cutting hair in a food establishment, I would have thought that would have been a violation of the food code, but evidently it's not. So that was brought up that they don't have a license, and it was in the premises. I don't know what the criteria
Grocery
is,
store, is it a
that
grocery
you can
store?
cut hair in the same place you're selling food and manufacturing food, I guess. I don't know what the circumstances were with that specifically, but I would think that common sense would dictate that you can't do those two things in the same building. But
Currently, right now, we don't have anything that, the only thing we have that we can do this person is take away the food license, right? That's the only control we have over,
right.
under current laws.
But if they're cutting hair, it shouldn't be allowed by the food code, I would think, that wouldn't be allowed in the premises. But my understanding now of the conversation was, you said the person doesn't even have a license to be doing haircuts. And you guys turn that over to Department of Regulation in Springfield, is that correct? So that's on them to deal with that. But I would think as a health department, we have the ability to go in and say, hey, you can't cut hair in a food establishment. I mean, you make people wear hair nets and everything else to protect people from, hair getting in food. I can't imagine if you're cutting hair and you're blowing around or whatever, the stuff's getting airborne and floating around and landing who knows where, that's not a violation of the food code. But the way it was explained the other night, you guys decided it wasn't, which I was kind of baffled by that.
Well, let me interject one other thing. Sorry. Randy, is your department against the idea of writing a strongly worded cease and desist letter to the guy?
So if I may interject,
I'm sorry?
if I may interject, the first complaint we received was not from Cody. It was from an actual licensed barber who had saw all of the videos on TikTok regarding the gentleman cutting hair in the back storeroom, the dry storage room. That is a food code violation, and we did write a complaint on it, and we did go out on that. And at that time, the owner of the store said that it was his son and that he would have his son stop. That report is also available online. The second complaint that we got was from Cody regarding the feces. Brian went out on that one. That was the one that was on the sign. The third complaint we got was from Cody. That one regarded the feces and cutting the hair. I told Cody, I said, we're aware of cutting the hair. Let me look on the TikTok video to see if it was continued since the first time we had been out there. I responded back to Cody that 3 more haircut videos were done. So we did go out and address that part of the food code out in inspection. And that was because that was now the second complaint that we've received regarding the gentleman cutting hair. I did turn it over to the Illinois Department of Professional Rights because you do have to be licensed to do any of that stuff. So we did handle the hair cutting incidents per food code because that is a violation of the food code, and the inspection reports show that.
And that was what month?
So the first one, I believe, was late August, and I think we went out at the beginning of September on that one. And so we knew of the haircuts from another individual, and we had even told that individual because he was a licensed barber, and he knew to contact Professional Rights for that one. Whether or not he did, I don't know, but I did my due diligence and was proactive when we got the third complaint, but the second complaint regarding the haircut.
So what was the consequences of cutting hair when you went out there and made an inspection?
So at the time, we did not see anybody cutting hair. There was no proof of hair cutting. So we wrote it up as an unfounded complaint at time of observation.
What about the next time?
Again, there was no proof of anybody cutting hair at the time. There was no hair to be found. There were no scissors, that kind of stuff. So at that time, again, it was unfounded based on observations.
But you said you saw videos online of them clearly doing this on the premises. Is that not enough evidence to take action?
That is why we took the actual complaints, was because we could prove that. And I will tell you, since then, the TikTok videos have all been taken down. So there is no proof of it.
Anybody at Fulton can I speak?
Look at me.
Okay.
Again, if they are willing, the board can allow public comment during the discussion. That's up to the board.
My question is though, so you had documentation that this was still continuing after over a course of 3 or 4 months. You're finding out about this again. What action did the health department take against the permit holder?
Again, we went out, we did a complaint investigation, we reviewed the food code and how this was not permitted under the food code, and wrote it up on an inspection report for the owner.
But there was no consequences.
That is correct, because there was nothing to be found at the time of inspection. When we go out and do an inspection, we have to be able to observe the violation in order to write it up. That would be like me saying, well, Debbie, I know your cooler went down last night. I'm gonna write you up for it. We have to have proof. We have to see it.
Let me ask this, if I may. You observed poop, fecal matter, at the time of going out and checking on the violation, correct?
We did on the outside. I'll let you speak since you were going into that.
And
Sorry.
has that been observed on each time of going out to respond to a complaint?
No, there was only two site visits, I'll say, that I made that, well, I made one site visit before I saw it, it was on the side. Then we received the photos of it smeared on the windows. By the time I got there, which was probably maybe a day or two after that picture was taken, it had been removed, it had been cleaned. It had been cleaned or removed, so it wasn't observed, I'll say 48 hours probably after the photo was taken, because that's.
Do we have any idea who's actually cleaning or removing it?
Sorry?
Do we have any idea who's actually cleaning or removing it?
Yes.
I'd like to make a motion to the board to allow Cody to speak in this incident, and give polite public comment about what we're discussing. I think he can add a lot to it.
Yeah, as far as it getting cleaned up.
Well, hang on.
I made a motion.
Second.
Do we need a?
Need a vote on it. So Ms. Goodman as chair, call for any discussion or vote?
Jeff, motion, Mark second.
Okay. All right, Vivian Goodman,
I'm fine with it.
yes. Mark Scranton,
Yes.
Candy Clevenger,
Yes.
Jeff Engler.
Yes.
Debbie Hill.
Yes.
Dr. Brett Jerker.
Yes.
Okay, now.
Okay. So, I'll try to make it quick. The first time that I made the complaint, there was a wad of feces that big directly above the entrance door of the restaurant. I called Brian, that's who I was directed to call, by Kathy, to deal with him. So I called Brian, I said, you're not gonna believe this is disgusting. I said, I'm not here at Wood Mountain Plaza. I said, apparently this has been going on. I said, I need, you to come out here or whatever. I said, this is the nastiest thing you've ever seen. And he went out there and called me from site and said, unfortunately, there's nothing we can do. This is a landlord-tenant situation. And he was on site there. Well, I called the owner immediately. I explained to him, I'm like, hey, this isn't gonna fly. This has to be cleaned up. It's been there for, 3 days. And he said, there's no violation. He said, you can't make me clean it up. There's no violation. And I'm like, I can't believe that's not a violation. There's right above the door like that. So it stayed there for 3 days until I got out there with a pressure washer because I clearly couldn't get him to clean it up. That was the first incident. And in the meantime, Brian was just doing his job. I talked to him on numerous occasions because he comes out and does our inspections on our septic tanks. I talked to him about this situation. I'm like, it's disgusting. The guy keeps doing it, smeared it on the walls. It's not like it's just they're kind of downplaying a little bit. It's not like a little amount. These windows are 10-foot tall windows, and he's reaching up roughly 7 feet, and he's not making little swirl marks. He's making 6 or 7 foot round circles, and Mark's seen the pictures, and of pure waste. At one point in time, when I called Brian, I said, Brian, there's gotta be something we can do. I mean, this is in front of the sidewalk. It's got so bad that the store owner has construction cones setting out front. So when the guy puts piles of poop or throws poop against his walls, whatever hits the ground, he just puts cones on them. I've talked to this guy dozens of times, screaming at him because I've got Creckles calling me, I've got customers calling me, complaining about the waste. The guy's rubbing it on the doors, on the door handles, on the windows, and on the closures, that he got closures. So I made my comment to Brian a couple times about, you can't tell me this can't be a health code violation. I think Brian would agree that I did call him and talk to him, and on numerous jobs. I see Brian in person. I'm like, you're telling me that this is not a violation? I'm like, I've talked to 2 other counties, and they said they would instantly stop this, talk to this guy about it, would do something. This is disgusting. So nothing got done. It's happened 16 times. I finally texted Kathy, called her, the number I have for her, that I've had for as long as I've been in business, and she's been here. And I said, can I speak with you? And she sent back a message and said, who is this? And by then I was already at the health department because I didn't know that they was allowing people to come in and talk in person. So she came to the front door. We went to a side room, and she said, as long as we're not talking about Board of Health, we can talk. And I said, it's about Wood Mountain Plaza. I said, this is disgusting. We've got to do something. So I showed her the videos of the haircuts, the guy scalping the people in the hair. On the video, she said I think she was looking on that evening or that day. I showed her the pictures of the waste on the window at that day on my phone. And then I brought up the whole thing that this guy is on video. She's seen this. He's opening cigar packages. He sells cigars. He's taking the cigars out of the package and replacing them with French fries, food, and selling them. That's all on video. She's seen the video. I think everybody has seen the video. It's got 4 million views. And then people are coming back in there and throwing the cigar packages and saying, cuss words and everything else. So I'm like, there's got to be something we can get the store owner on to make him stop doing this to these people. I mean, he's cut 17 people's hair that day, and they all are mentally challenged. I mean, you can tell by watching the videos, they have problems. So it got so bad, I talked to Brian numerous times that this particular day that I finally, when it got so bad on that Friday, I finally had that problem where I called screaming, of course. I texted Kathy instantly. I said, showed her a picture of it. All she sent back was, ooh. And I said, there's gotta be some sort of violation that's on the windows, the doors, the sidewalk, the handles. I mean, it's getting tracked in. The police department's made reports to me. They're like, hey, we've had people call and complain that they're getting poop on their shoes. Freckles has called me numerous times and said, hey, we've been here 30 years, we're leaving if you don't get this stopped. I'm like, I can't get it stopped. The police say to call the health department because it's a health issue. It's not a destruction of property. We can only cite him for defacement, whatever you want to call it, defacement of property. If we can't do that about the health side of it. So that's why I was reaching out numerous times. And yes, I did get upset Friday because Kathy was aware of the problem Friday morning. And then I'm like, I need, really, the letter has got blown out of proportion. I really wasn't asking for so much never said a special letter or a letter. What I was really wanting somebody to give me in writing to say there is no violation or no health concern, because I couldn't believe it. And hundreds of people that has asked me about it, said there's no way, there's no violations, there's no concern here. I wanted to see it in writing. I mean, if you walk up to a restaurant and give them a violation for doing something wrong, they hand you a paper and say, here, you did something wrong. Why can't they hand you a thing and say you didn't do nothing wrong? Because by them telling the store owner that there's no violations and there's no, nothing wrong, to this day, if I call him right now, he'll tell me, Cody, there's nothing you can do. This is not a health violation. They can't take away my food license. I was desperate. I was saying, you're gonna get in trouble. They're gonna eat your food. Something's gonna happen. You can't keep doing this. But apparently there was, no violations. I would think with tampering with food, with cigars, cutting hair in the building, and I mean, there's no question it was happening there. I mean, no one's denied that. It's happening there. I mean, the owner of the store's admitted it. So, but he's never had no trouble for two of the things that I think should be a violation. As far as the haircuts, I didn't ever ask for a I was just like, there's gotta be some sort of violation. But as far as the cigars and the waste outside that's getting tracked in and out of the store, there's gotta be something. I mean, so that's the sum of it.
Well, and again, as I referred to in the market, I don't know what your lease agreement with them is, or if you have regress under there. But I would certainly advise you to look into that with your attorney.
Yep.
The second thing is, am I correct in what information I've been given that the offender, the one placing the fecal matter on the outside, has not yet been caught, is that correct?
No, police are still looking for him.
Yeah, okay, so,
But also to add to the comment, I've never been told, I've never even heard it until this meeting about calling neighborhood standards. Kathy nor Brian never told me to call neighborhood standards, and this is their territory, because the Decatur Police Department says that, you know, it's this defacement of property. That's all they can do legally to this guy. They can't, I mean, he's not broke nothing, he hasn't tore nothing up, he's just literally doing a nasty thing because he's trying to get revenge from them. And my theory is that they would get in some sort of trouble of any kind, maybe they'd think about it. My daughter looks at TikToks all the time. The videos are right back on there. Anybody that followed them videos, he took them down, but anybody that followed them can still see them.
well, I think it's clear, at least to me, from at least not a non-criminal aspect, that we've got some despicable people here.
Oh, yeah.
You've got the business owners, and then you've got and maybe despicable is not the right word, if there's someone who's, you know.
Yeah.
But you've got someone with problems that's responding to a harm done to him that we need. I understand the outrage. The problem is legally, in terms of the ability of different departments to respond in a uniform manner that they would with anyone else. That's the problem. So it gets us back to the question on the floor tonight, which is whether or not, as Mr. Scranton said, to try and adopt something tonight to address this particular issue. That's one option, and I would suggest again, as I already have, that's not a good thing to do in a rush tonight, but look at it in the future, and with a side committee or something. Secondly, though, the other issue is, I don't know if, and again, the question didn't get answered distinctly. Is your department leery about writing a letter basically saying you need to clean this up when it happens to the owner?
I just have the question, like I said, is what are the parameters? Because I'm sure there's been other situations that have been similar or somewhat similar. So is it anytime we happen to notice this, anytime we get a phone call, anytime a certain person calls and wants it? I want parameters, because I don't want to put myself or my team on the line liability wise for doing things inconsistently, to your point, to Mike's point. And I'm not trying to be difficult about it. We have talked about, you know, neighborhood standards, and when Kathy and I talked to Cody, I did bring up the tenant lease agreement thing, you know, in hopes that he would have some kind of action that could be taken. But the original, like I said, the original letter request was not to say it's a hazard. I realize I'm at the discretion basically of what the board tells me to do, but that's my concern.
Well, I understand that, and certainly a letter that I'm envisioning of those, well, hell, maybe I'll just get together with Mike and suggest what we write, so it's legally acceptable. But what I would suggest is that the board direct Ms. Dinkley to write a letter that would not be, you know, it wouldn't refer to, we're gonna come in and close you down, or, because we can't do that, but basically a strong word letter saying, look, this is an issue that people are upset about. You need to make sure that the facility is clean inside and out for customer appearance. And, you know, we're not threatening any legal action we can't take. It's just put him on notice and see if he complies. And if he doesn't, then, you know, we may be screwed, but at least we tried to do that. And like I said, again, I repeat myself, I'm sorry, but Mr. Carter, look to your attorney to see if there's something that this violates the landlord lease, because if Freckles is really worried, if you can get him kicked out of there as a bad tenant, then maybe that's the best.
Our lease says he has to, you know, he has to be in violation of something. That's why I can't get nothing, I can't get no violations, so I can't do nothing. And to speak back on to the whole, me calling and getting rowdy, I addressed you and I told her, I've never cussed specifically anybody. I was very upset because this is not the first time, this is the third time that I've had major incidents with this over the last several years, and I've gotten some major trouble for not getting the backing of the health department. But I did tell you I would call back and apologize to Susan Monday. I made three calls or 4 calls to the health department, I got no answer. I mean, I know that's beside the point. And I also reached out to Brian that day. We had inspections, and so for some reason I don't get my phone calls answered at all, and I don't get a return call. So which is okay. I've accepted the fact that I'm not gonna call the health department no more for that kind of violation. And when I tell my tenants and people that rent off me, like I told Correctables and I told other people, I'm like, please call the health department, please complain. And their response is, no way. I don't want to get retaliated against. That's not just me saying that. You can ask any business owner in Macon County, any restaurant owner in Macon County, you can ask numerous people, and we deal with a lot of them. If they're told to call the health department, they're scared, they're on a level of being scared of the health department for retaliation. Debbie, am I wrong?
Yeah, you're not wrong.
I mean,
People are
you got.
Scott, I want to kind of wrap this up. So as it stands right now, I'm taking two things out of all this conversation tonight. Number one, I think we probably should consider, I'm not saying we should, but we probably should consider putting some kind of committee together if it doesn't exist in our current bylaws or current committees. I hate creating more committees because I don't like doing that, but if this particular instance, if it requires a mixture of people from the public and staff and maybe one or two board members or whatever to kind of evaluate this type of thing, maybe get the law enforcement, state's attorney's office involved for some little bit of legal guidance on how we move forward with this. But at the end of the day, I take away the same thing I took away last week was we have an assistant state's attorney telling the health department, you guys do have the statute allows you, and you have the latitude to write a letter saying, you have a problem there, we're letting you know that we're aware of the problem and we strongly urge you to take the appropriate actions to correct it. I think that in itself says a lot. And I think at minimum, at least that should get done. Because now I'm hearing tonight that this stuff's been going on since August with this particular business. I thought it was only in the last 30 to 45 days. Now you're telling me it's been going on for 4 or 5 months.
No, the last 30, 45 days, it happened 16 times.
Yeah, but I'm saying the other situations that now have been brought up that this was been going on since August, that concerns me because it's like, what we can do if you guys are restricted by not physically seeing it on site? Do we need to revisit the ordinances or the policies or guidelines or whatever to give you guys the ability that if you get, I mean, is it admissible, Scott, if they've got actual video of things being done that are in violation? Is that in itself enough to constitute saying you're in violation of the food code versus an on-site inspection?
You know, the problem with, well,
From a legal
is it
standpoint, I'm
admissible?
saying.
Yes. Is it enough proof to be able to prove something that's questionable? You'd always have to prove like origin, time it was done, who's involved, location. And you can do that by looking at background or by what's said and who's involved. So proof is, admissibility is different from actual proof that's going to win you a case. What I would, you know, what you're experiencing here is what happens when legislation gets passed in Springfield. Something happens and people get upset, and so there's a movement to do something about it because the laws, which have to be specific and can't just be general, they have to subjectively identify people of the harms that are prohibited. So they have to be very specific, they can't be general. Then you run into a situation that that specific language does not cover. So now you want to make language that would cover this specific, what's viewed as a harm. So you're not doing anything different here. You're not running anything different than happens in our legislators in Springfield in that respect. And sometimes the sad truth is, even though it seems like it should be a violation or a crime, it's not, because the law hasn't been developed to address it appropriately. So I would, I guess, suggest a couple of things. And again, no offense to you, Mr. Park, but if you don't have a condition of your landlord-tenant relationship that gives you some authority to expel a tenant for not conforming to what you want to do, maybe you need to look at your landlord-tenant agreements. But for this board tonight, what may be appropriate is to have a motion to have Ms. Binkley write a letter similar to, I like the language that got used here a minute ago about what to instruct the business owner that you're on notice. I forget the exact language that was said a few moments ago, but I like the way that sounded, and if you want Mr. Baggett and I to draft such a letter for your proposal and submission, we'd be happy to do that.
I think that'd be beneficial.
Let's get this smoothed out, sailing, and on its way.
Yeah, 'cause I think there was some confusion on landlord-tenant rights, you know what I'm saying, as far as, in my case, my lease clearly states that I have to have a violation,
Right.
go after
I
them.
understand what you're saying.
But like, back to the House of Meats part, that was an indoor, inside of his facility, where his coolers, when he was in the process of moving, he was still open for business, he unplugged them, so all the rotten meat and juice ran all throughout the building, and they didn't go into the facility, they just said, sorry, that's a landlord-tenant situation, we can't get involved. I mean, I would think that should be, you get involved in something like that when there's, when they're grinding meat.
That's
and
their
there's
discussion.
Yeah, it is.
Right, so does anyone want to make the motion?
I'll make a motion to the board to ask that Brandy, with the help of the state's attorney, draft a letter.
Cease and desist letter.
Cease and desist letter that, I guess, can we float that around email to get board approval, and then?
I don't think we need to. If the state's attorney writes it up
Okay,
and
good.
gives it to Brandy, that's good enough for me.
I'd make that motion.
Second.
I second.
Need a roll call vote. Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Candy Clevenger.
Yes.
Jeff Edler,
Yes.
Debbie Hill,
Yes.
Dr. Brett Jerger,
Yes.
Cody Parks.
You can't vote on it.
No, okay.
Yeah, he can't go.
So you'll draft and then send something to me?
You got Mike, probably I'll give this to your Mike, but we'll talk about it and get to it.
And then this is just for only this situation, and then the board is going to move forward possibly with something else to give us parameters and all that in the future, is that correct? Okay.
Yeah, I think we should do that.
No, I'm sorry, I don't want to prolong meetings, but you had another issue you started to bring up that interrupted, so.
Oh, that's okay.
And this is under the same category, so it's on the agenda, so. Go
Yeah,
ahead.
so, as you all know, the board allowed for the Wits End to apply for a new permit with stipulations that would be set forth at the discretion of staff. All of that was agreed to by Wits End. All that's been set up. They have not adhered to all of the stipulations. I did talk to Mike about that because I know that's been something the board's been heavily involved with. And he did say, bring it to you, basically have you guide us on what you want us to do with that. So I know someone started to ask what were the stipulations that have not been adhered to. I know temperature logs had not been turned in. Some got turned in today, but not complete or what all was due. So I'll let you speak to it. I think there was 2 or 3 things.
Yeah, so we talked about, part of the stipulation was weekly temperature logs being sent to us and cleaning logs, just to make sure that they are following those things. In the very beginning, she did a great job sending them to me, but I did notice with the temperature logs that it was the exact same temperature all day long, no matter what. Same, if it was taken at 1:30 today, it was at 40 degrees. It's gonna be taken tomorrow at 1:30 at 40 degrees. So I did bring up some questions about, hey, are we actually taking temperatures? Or I find it, as being in this for 17 years, I find it very hard to believe it's the exact same temperature at the exact same time every single day. Then I didn't get a lot. In fact, I didn't get anything until this morning. She gave me a few weeks this morning. Another thing is they were supposed to have a pre-comp sink put in by a set date. That did not get done. So we've extended that. They're supposed to
What did you
get
say it was?
a 3-comp sink in the dish room. Then they also, whenever they get an inspection.
3-compartment sink.
Yeah, I got that, but I'm confused because it didn't have a 3-compartment sink. How did they open back up to start with?
That was an error on my side, because I assumed that the 3-compartment sink was in the dish room and they just did not include it in the drawing, because how can you be open this many years without a 3-compartment sink? And it wasn't until Jerry did the actual opening that he's like, there's no 3-compartment sink. So I gladly will take the error on that one. So we did give them 30 days to get that done. And they said that they could meet that 30-day guideline, and they didn't get that done. One of the other stipulations is every time there's an inspection, no matter what kind of inspection, we've asked that either Tina or Tasha respond back to me with email within 24 hours going, hey, we did receive the inspection report. We are aware of what the findings were, and this is how we're going to address those. And that has not happened yet either. So, you know, I understand that right now everything is new, you know, that they're trying their hardest. You know, I've spoken to them quite a few times on the phone, off and on throughout different inspections. But again, you know, these were all stipulations that we agreed to and they agreed to, and they're not holding up their end of the deal.
And just so you know, I did have Kathy go ahead and draft something up and send it to me. It's just an email that would go to Tasha and Tina. If the board wants us to proceed this way, that just basically says, you know, there are these certain stipulations that were in place. These are the things that haven't been met. And then an inspection was completed. Oh, no. Sorry, I was reading the wrong part, but just, do you have any questions? Basically, you know, requesting that they get this stuff taken care of. So I don't know if you wanted more done. I don't know how you want us to proceed. This is obviously a different situation than we've had before, and the board kind of took this, you know, this one, as far as how to progress with allowing them to reopen. So we wanted to bring it to you tonight and at the guidance of Mike Baggett to see how you'd like us to proceed.
Send them a letter citing these issues, requiring them. I'd send it even certified mail if you want, just to cross all T's and dot the I's. And I would send them a notice say that they are required to respond within 10 days of receipt of the letter on what actions they're taking to correct these, or if they have been on to correct what they did. And then if they don't respond, then I guess that's a matter for next month's board meeting.
And just leave them open and don't do anything until then, as far as, is the board all in agreement? Just do that and kind of wait and see if they respond and then bring that back to you next month.
Did we not give them guidelines for, if they did not meet the, right, if they didn't meet?
Yeah, we told them that if they did not meet the stipulations, that their permit would be revoked indefinitely. And that's in writing.
Okay.
So we use this letter as a warning that says
I'd send that letter with
you violated.
a copy of the original letter, you know, or the original agreement, and say you're getting your 10 days or whatever many days you want to give them. And if this isn't met, you have sealed your own fate.
Yeah, I would agree.
Always,
Because there's
I'm
two
always
sides of each
decided
story,
having a
so-
business be open, but they had stipulations and they're not following them.
Thank you.
I mean, it's an absolute slap.
Yeah, we
in the
voted
face.
to let them reopen, but we also said that they had to
Absolutely.
follow the rules, so it's that
Oh,
simple.
and I'm sorry, I also forgot pest control. They were supposed to report to
Oh,
me
yeah.
monthly pest control to show that the roaches weren't coming back, and I haven't received no reports of pest control.
Yeah, it doesn't for me, I don't understand. I mean, they knew what they were supposed to do. We gave them, we were beyond fair with them,
Yeah, they had,
beyond fair.
they had a fair shake.
I got it.
Are you good with that action?
I am good with what the board tells
Are
me.
we, is that permanent or does it need to be different?
Does it need to be voted on to make it so I can write a letter at this point saying that the permit has been revoked indefinitely?
If they don't.
I want them to get the opportunity to respond, because right now we're convicting them without them being here to defend themselves, and I don't think
Plus,
that's
that's
right.
we made a mistake not letting them open without the sink. That was kind of on us.
I agree.
So at least
Yeah.
give them another round.
I will 100%, and I told Brandy this, take onus on that one, because I automatically assumed that after this many years in business, they had a 3-compartment sink. That's the most basic thing for dishwashing.
Exactly.
So when he didn't, or when she didn't include it in her drawing, I just assumed, yep, it's there. And that's why we allowed them to open without it, because they did have a dishwasher, and we did give them 30 days, which was a time frame that they agreed on, that they would be able to have it in within 30 days, and they have not. So we've continued to work with them. I don't want you guys to think we're not working with them. We've continued to work with them. But again, I want you guys to remember that you told me that it is not my job to babysit her and babysit this establishment, and that's what I'm doing at this point, because there's no emails, no temperature
I would
logs.
say
all that
file a
stuff.
letter. They can't call
And you
them.
have 3 violations other than the sink?
Okay, so, oh, go ahead.
Make it whatever time frame you want. I'd send it by registered mail, so it's gotta be dated and signed. That way it's recorded and the clock's ticking. If you wanna give them 2 or 3 days to respond, to take action or whatever needs to be done, because, I mean, the sink, you're saying is on us or whatever, even though they've had ample amount of time to do it. The other items, you know, I would think would be considered probably minor issues in the scheme of things, but maybe not. The pest control thing, if they just send documentation saying, hey, we've been doing it, here's our paperwork, we thought we sent it to you, we forgot, whatever. I want to make sure they're actually doing the things is my primary concern. If they can't show a track record of pest control being done, which I find hard to believe after all the stuff they did, then that first and foremost, that right there is probably the nail in the coffin for me. But I think we should probably at least give them the courtesy of, and you can make it, you know, within 48 hours or 3 days, whatever you want to tell them, the receipt of the certified letter. If you haven't supplied us these documents to support that these actions have been taken and further evidence that they actually have been done, then we're gonna revoke your license. And I don't know if that requires a board action to do that or not.
I think I sent out 4 letters, so I sent out to both girls that was here,
Send to everybody
Al, and to the restaurant, that way all
Yep.
4 letters certified, and they got.
Nobody's got any excuse about not being told that they weren't told about it.
Can the board please decide the number of days, just so that's a board decision?
10 days.
Just because right now, even though there's no excuse for not having a sink, I know for sure how long it's taking to get stuff right now.
Yeah, and
It's
the
taking
mail.
weeks to get simple off the
And
shelf
it's the
things.
holiday, 10 days, I think 10 days is plenty.
Or if you want to,
Receipt of the letter, because, I mean, I just got a letter today that was sent here to Decatur, that was sent 10 days ago, and I just now got it today.
That's my issue with certified mail is we have renewals right now, and we had a renewal with the check sent in mid-November, and we just got it today. So I mean, certified letter, I mean, it could be out there for 3 weeks before she even gets it.
Here's what I would do, to kind of help alleviate that, I would send them an email tomorrow, once you get the letter drafted, saying, here's a copy of a letter that is being sent to you via email and certified mail on this date. You're being hereby notified that these require an immediate response from you within the next 10 days. That's what everybody.
Well, we just need to give them a date in January.
Right, but that gets you
January
out of the certified mail situation. If you send it via email, say, here's a copy of a letter being sent, lawyers do it all the time. Here's a letter that I deposited, I deposited this letter in the US Postal Service. I'm also sending a copy via email. They do it every
I
day.
cannot be in person, like, go out there and inspection. in
No,
person,
you need to have.
No, I'm
something
saying email
right.
also, I'm just saying, and letter, I'm just saying to go out there and say,
The thing is about a 3-vat thing, like right now, I give them a magazine that I order everything from me, and it takes a while to get those.
I'm waiting 14 weeks for something right now.
If things
Still no
are
excuse,
not
they knew
coming-
it was gonna open.
We
They
don't
knew they
have
had
a
to.
restaurant, store to go buy a 3-vat sink, so we've gotta be a little bit, you know. They do have a sink, but it's not.
But you know what? On devil's advocate to you, they knew that one 30 days ago.
Yeah,
They
yeah,
haven't
you're
told us,
right.
all they have to do is say, hey, we've ordered it, here's
They
the
need to
proof.
respond.
Boom, that's
I put a
it.
deadline of
That's fine.
January
To
15th.
that,
Be done with that.
when we went out to do the 30-day inspection is when we found out, and we asked, why didn't you call and let us know that it wasn't gonna be here? And they had no answer.
Exactly. So like I said,
That's
all we need is proof that they've ordered it. And I'm good with that. I have no problem. And then we have proof that it get put in. I have
And
no
we
problem with
know-
the supply line
We know
chain.
that they have a permit, a plumbing permit pulled, we've seen that, but that's all we've seen.
Yeah.
And that was with us going out.
Would you not agree with that, Debbie, though? I mean, as long as they prove that they ordered it.
Sure.
10 days is January 5th.
Right, so
So everybody knows.
what date does the 10th fall on? I didn't look at that.
No,
That's what I was
10
trying to
days
pull up.
is January 5th. I wouldn't give them until the 10th of the month. I would not do that. Give them 10 days, 10 business days.
10 working
10
days.
business days.
Right,
That's January 5th.
What did you come up with? January 5th?
5th, yeah. Unless my math's wrong.
Did you count the holidays and like take them out?
Candy, you start
Yeah.
to say something.
He does.
Oh, okay.
Thank you.
So depending if you want to call it 24th and 31st holidays, then it'd be the 6th. Otherwise, 5th.
So what are they gonna do?
But I'd send it to them via email and certified letter. That way they got no excuse to send it and receive it.
January 5th or 6th then?
Well, if you're, are you calling I guess, are you guys closed the 24th and 31st? You're calling those holidays?
Well, the health department is, but I mean. I'm
Well, I know,
thinking
but those
more on
aren't,
them.
those could be termed as not being business days then, so make it the 6th.
Right, that's what I'm, okay. Is everybody good with that?
Yes.
Thank you. That's all. That's all I have, but I don't know if you have anything else.
Okay. Good.
I think so. Anything else for Kathy or?
No, I'm glad you brought that up though, because that's kind of disappointing.
Thank you both for
Thank you,
being here. I
guys.
appreciate
Guys,
it.
Merry Christmas.
Bye, Merry
Thanks.
Christmas. It is
Okay,
disappointing.
we have a motion to move into closed section.
So moved.
Second, third.
And where are all of our people?
Potty break.
Yeah, Jeff went to the bathroom, Sue and Dr. Miniganti had to leave. I think they went back.
Yeah, I know they left.
Yeah.
Thank you.
Thanks, Scott.
Oh, no, I'm just closing the door.
Oh, okay.
Okay, so
If you don't need me, I will leave, but if you need me around, I'll stay.
We leave the meeting.
Well, we need somebody to buy drinks afterwards if you stick around a little bit longer.
I need my bed.
or that can open session, roll call. Vivian Goodman. Here. Mark Scranton.
Here.
Candy Clevenger. Here. Jeff Engler. Debbie Hill.
Here.
Dr. Brett Jerger.
Here.
Cody Parks.
Here.
Same.
So we have two items that we need to, Mark, are you motioning to table the flex time until next month?
Yes.
I'll second the motion.
Vivian Goodman.
Yes.
Mark Scranton.
Yes.
Candy Clevenger. Jeff Engler.
Yes.
Debbie Hill.
Yes.
Dr. Brett Jerger.
Yes.
Cody Parks.
Yes.
Motion carried. And then we need a motion to approve Brandy carrying over her vacation time in January.
I'd make a motion to second it. Allow for me to carry it.
Vivian Goodman.
Yes.
Mark Scranton.
Yes.
Candy Clevenger. Jeff Engler.
Yes.
Debbie Hill. Dr. Brett Jerger.
Yes.
Cody Parks.
Yes.
Motion carried. Thank you. Anything else for the good of cause?
I make a motion we adjourn.
Motion to adjourn.
You know, before we adjourn, I just want to make one public comment. I had my booster vaccination last week here at the health department, and the process was very smooth. The people were very courteous. I was a walk-in. They didn't know who I was. It was great service, and it's probably immaterial, but it was painless. But I just wanted to make that comment. Thank your staff. And I think I made that comment.
Thank you for sharing that. Yeah, they were very
So we
grateful.
have a motion and a
Gotta vote first, Gabby, come on.
right. Roll call for
Who was the motion?
adjourn, Mark, to adjourn, Mark and Debbie.
Vivian Goodman.
Yes.
Mark Scranton.
Yes.
Candy Clevenger. Jeff Engler.
Yes.
Debbie Hill.
Yes.
Dr. Brett Jerger.
Yes.
Cody Parks.
Yes.
Oh,